I request you to please wait for a few minutes so that this conference could be officially announced open.
Sure.
And our Dean sir will be doing this very shortly.
No
The,
problem.
the internet just arrived here, and due to a lot of rainfall and storm, there were problem in the internet connections since last night. So our Dean and Director sir is here, and I will ask him to start with this conference.
So would my session be delayed by about half an hour or so?
No, no, sir. We will be just starting in 5 minutes, sir. It
No
will not
problem.
be delayed,
Okay.
and we will not be changing the time as I have provided you the time slot for 10 a.m. onwards.
No
Our Dean
problem.
sir is here. So please unmute yourself and please welcome our guest and start this conference, day two of our international conference on the theme of advancement in homeopathic research, including clinical trials, lab research, and case studies. Dean sir, please start with this conference. Please unmute yourself, sir. Unmute कर दीजिए.
रवि,
जी सर.
डॉक्टर मिर्जाना को आप मेल कर दीजिए टाइमिंग.
जी सर. अभी सर.
ओके सर, आ गए क्या वैष्णव सर?
हाँ, डॉक्टर विजय वैष्णव सर हैं, डॉक्टर प्रवीण एस सर हैं.
नमस्कार सर, I welcome to you. Today is second day. First session will start open.
Thank you.
Now I request you, please sir, start yourself
Okay. Thank you.
on the topic.
All right. So I'm Dr. Vijay. Do you want me to introduce myself first?
Sorry.
Should I introduce myself first so that
Yes sir.
people-
Yes sir. Yes sir.
Okay.
Please.
Thank you, Dr. Sharma, for this kind invitation, and it's an honor to speak at your university. And let me give you a short introduction. My name is Dr. Vijay Vaishnav. I have been the head of the Department of Homeopathic Materia Medica at CMP Homeopathic College in Mumbai. And I was teaching there for 25 years. The last 12 years, I have been now in the USA, where I'm practicing in California. And I have 3 clinics in 3 different cities here in the San Francisco region. I'm also associated with the California Homeopathic Medical Society, where I'm on the board of directors. This is the oldest society, sir, in the USA. It was founded in 1877. It's the oldest homeopathic society. And it's an honor to be also involved with that society, where we work and we have regular conferences, and we have lots of interactions with other homeopaths all over the country. And I have also been, apart from teaching at the Homeopathic College in Mumbai, I was a member of the American Homeopathic Medical College in Arizona and Phoenix, and the Caduceus Institute of Classical Homeopathy. So, just a very short introduction. I would like to start with my session. I'm going to present slides. Okay. Are you able to see?
No sir. Not yet. It is.
Not yet?
Yes sir. Now we can see.
Can you see it?
Yes sir.
Yeah.
Okay. So I'm going to talk about the role of homeopathy in treating pathological cases. I was told by Dean Professor Sharma sir that a lot of students are also going to be attending, and of course, apart from faculty and other homeopaths from other parts of the country and the world. And because I'm also going to talk to students, this session is mainly to encourage our homeopathic students and freshly passed homeopathic doctors to have confidence in themselves and to be able to take up challenges. That is why these cases that I'm presenting today are cases that I had seen when I had just started my practice. So it was many, many years ago, since 1985, 86, 87. That's the time when I had seen some of these cases and I preserved them with the hope that it might be of some use and inspiration to the new generation of homeopaths. So the first case I'm going to talk about is an acute condition. So today I'm going to talk about one acute condition where there's a pathological problem where homeopathy can work. I'm going to talk about a constitutional treatment for another case. And then I'm going to talk about one case where a specific remedy was given. So, three different types of cases, three different ways in which you can use or you can apply your knowledge of materia medica in prescribing. So, this is a boy who was around 17 years old. He came to my clinic and he actually collapsed in the clinic. He was a known case of bronchial asthma and he had been taking treatment from a lot of doctors. But the past 6 months, he had started homeopathy and he was coming to me regularly for the treatment of his asthma. He was appearing for his 12th standard exam and he had not been eating well. At the same time, he had been very anxious. So his parents felt that some of his breathing issues are because of anxiety. But when he came to the clinic with his older brother, he actually could not even speak and he almost fainted in the clinic. When I examined him, and I used to teach, initially I used to teach clinical medicine and I used to teach internal medicine. I used to attend the KEM hospital in Mumbai, which is one of the biggest hospitals, allopathic hospitals with the medicine department. I used to take rounds with the head of the department. So I was doing a lot of medicine work as well as homeopathic materia medica and therapeutics in our college. So this child was brought, and when I examined him, I found that all over the areas in his neck region, there was a lot of crepitation. That means air had escaped from his lungs into his subcutaneous tissues. So I immediately sent him for an X-ray to the local radiologist, and he came back with a note saying, Dr. Vaishnav, I confirm your diagnosis that this is a case of surgical emphysema, and it looks like a bullous emphysematous bulla in the lung. He had emphysema. So the lung tissues had become very thin. The alveoli had become so thin that one of them burst open and air entered the mediastinum and then it rushed out and went into the neck region. So let me show you the X-rays. So in February, on 17th of Feb 1989, so it's a long time ago, I was just freshly out of the college and I was teaching at the homeopathic college at that time. So you can see that there's a lot of change in the appearance here. This is where air had filled up because somewhere in the lung, the bulla had ruptured and air had entered the mediastinum and it had gone into the subcutaneous tissue in the neck region. He could not move his neck. The slightest movements were painful. And we decided to admit him in our homeopathic hospital. And I called up the surgeon, the ENT surgeon, and said, I'm admitting this student, this child. There might be a possibility we might have to do a tracheostomy if he cannot breathe well. But we would first want to give priority to homeopathy and treat him with homeopathic medicines. Now, in this acute state where he was, slightest movement aggravated him, he had shallow, rapid breathing, he had stitching pains in the chest region. With every breath, he used to get pain. And the fact that he was extremely thirsty, we decided to start with bryonia for him. And while he was admitted, he was kept nil by mouth for the next 24 hours in case he needed emergency surgery. So we were ready that there might be a need for surgery, but we said we will first try homeopathy. Now, 3 days later, the patient's X-ray was repeated and we found that quite a bit of the air had started getting absorbed and he had become asymptomatic. He was able to move his neck, he was able to breathe better, and in general, his condition continued to improve. And then on the 24th of February, as you can see here in the last, all the air has got absorbed. So these are all positives of the X-rays. They are not the negatives, but the actual positives. So when the printer made this, it was also published in one of the journals. He made a positive out of it. So you can see that now this line is gone and all the air got absorbed. Now this patient's father was working with the Indian Airlines. He was a general manager. So he decided that he would like to take a second opinion. And after we discharged him on the 25th of February, he went to one of the chest specialists in Mumbai and said, "This is what happened to my son." And the doctor says, "I don't believe it, because with allopathic treatment, it would have taken at least 2 or 3 weeks for him to recover. And I can't believe that in 7 days, your child has become perfectly normal and he has recovered completely." So this is a very simple example of an acute condition where there was a pathology, there was a rupture of the alveolus in the lung, which caused air to escape into the mediastinum and also into the subcutaneous space. So under the skin, everywhere you touch him, it was like crackling. And just simple bryonia took care of it. This person also was on IV fluids for a few days because we didn't want to give him orally anything in case he needed surgery. And he developed thrombophlebitis. So after, when we discharged him, we decided again not to give any local applications like what you get in the allopathic field, thrombophob or anything that would help reduce the venous thrombosis. But we decided to give him hemamelis. Hemamelis is the aconite of the veins. So it is useful for any acute inflammation in the veins. And in this case, it was post-trauma. The needle had caused inflammation and he had developed thrombophlebitis. And so again, a simple pathology in the vein we took care of with just plain homeopathy, and that too internally without any external applications. So this brings us to aphorism 2, where the highest ideal of cure is rapid, gentle, in the shortest, most reliable, and most harmless way. And that is exactly what we achieved in this acute case. It was rapid. Even the allopathic physician was surprised that in 7 days he recovered completely. And it was quite reliable because we were able to give him the result. Gentle because we did not have to do anything like push in a needle or a tube and get the air out. And there was, of course, no side effect of the homeopathic remedy. In fact, the side effect of the IV fluid in the injection also we treated with giving him hemamelis. Now, there's another case that I would like to talk about, which was again a surgical case. This was when I was a registrar in the hospital, and our principal, Dr. Anil Bhatia, who was also the superintendent of the hospital. He got this patient in the OPD, in the outpatient department, with acute intestinal obstruction. Basically, what happened was that he had a perforated ulcer, and after that, everything stopped. So it was an adynamic obstruction. And he had severe pain in the abdomen. So Dr. Bhatia asked for an X-ray of the abdomen in a standing position, and it showed air under both the domes of the diaphragm, which means that there was a rupture, there was a perforation somewhere, and air had entered from the intestinal tract into the peritoneal cavity. Now, on the basis of one keynote symptom, so this is the use of keynotes, he gave Refanus to this patient. The patient said that, "Doctor, I'm trying my best to burp. I'm trying my best to pass gas from below, but nothing is coming from above or below, and I'm feeling so full, and I'm feeling so distended. I cannot bear this." So on the basis of this acute pathological condition, once again, the surgeon was informed that we might need his help in case we need to take care of the perforation. But just simple Refanis 30 potency was given to this patient, and the indication was tympanic hard abdomen, no flatus emitted upward or downward, griping about navel, pad-like swelling of the intestines, and vomiting of fecal matter. When you have vomiting of fecal matter, it means there is intestinal obstruction. So this is another case which I would like you to look at, and I would like you to study this remedy, because this is a condition that sometimes can happen, and what I would call these as pseudo surgical conditions. For a surgeon, the first thing they will do is they'll open up and they will try to stitch that part or repair it. But for some of the homeopathic doctors who are experienced, this is pseudo surgical. They can treat with homeopathy, and we also made sure that the surgeon was available on standby in case of the need for surgery. He would go ahead and operate and make sure that the patient doesn't suffer because of the homeopath's neglect. So we made sure that we had every infrastructure available, but we treated him with homeopathy. So these were the cases that I saw. The Refanis patient was when I was a registrar, and this Brianna child with the subcutaneous emphysema was in the first few years of my homeopathic practice. So I was a very freshly passed doctor. I was teaching at the homeopathic college, and at the same time I was also seeing patients privately in my clinic. Now let's talk about a constitutional remedy. Deep vein thrombosis. This is a condition that can occur in many patients. It could be after injury. It could be after a long flight, when you're sitting for a long time and you're not making any movement. You could cause the blood in the veins to get thrombosed or clot, and that causes a problem. So this was a patient who was very young, 34 years old patient, and he was admitted into one of the top hospitals in Mumbai. He was one of my students' uncle, actually his older cousin, but he was almost the age of her uncle, because she was, I think, around 18 or something, and he was 34. So he had this pain and redness in the calf region in 1995. This gradually went on increasing, and he had already been treated with anticoagulants. But then there was a time when he got severe pain in the left thigh, and it spread all the way down to his foot. So because of that, he was admitted in the hospital in 1997. As I'm told you before, I'm purposely showing you cases which are many years ago, mainly because I want you to realize that even if you're a junior homeopath, you should be able to have the confidence to treat cases and use these examples as an inspiration to work harder and make sure that you do not fail homeopathy. And because of you, the patient can get a better quality of life. So the color Doppler was done, and it showed deep vein thrombosis of the left external iliac, posterior tibial, and the other veins of the lower limb. Now, if you look at this color Doppler studies, you see that there are two different colors coming in here. That means the flow is in the backward direction. Out here also you see they're not in the same direction, but it's because of the fact that there is now the valves are not patent, and that's leading to some amount of reflux in the veins. This is the report that we got. The left common femoral vein indicating the presence of a fresh thrombus, and there is a thrombus in the superficial femoral vein, popliteal vein, and the anterior and posterior tibial vein. That means the whole of the left lower limb had got thrombosed. Almost all the major veins of the left lower limb were thrombosed. So the opinion was extensive deep vein thrombosis in the left lower limb. Now, apart from this deep vein thrombosis, there was something else that was there in his pathology in the background. He had a degeneration of the hip and the vertebrae, and an MRI of the spine had shown a left lateral herniation. at the L3, L4 level, and posterior and lateral herniation at the L4 and L5 level, and again at L5, S1. And there were arthropathies. That means there was degenerations of the joints between the vertebrae at L4 and L5. So you see there's a lot of degeneration occurring here. There's some amount of osteoarthritis, some amount of disc prolapse. He also had become very irritable. So apart from this, we also found that mentally he had become very irritable, and he was afraid that because of this condition now, he will never be able to walk again. And if he cannot walk again, he will never be able to earn a living. He had his own business, and he felt that he will fail in his business. He will become very poor. He will not be able to afford even the simple necessities of his life. He also had on examination, apart from the straight leg raising test, which was positive, that means there was some amount of involvement of the spine. We saw that the tongue was cracked and fissured. In the family history, we found that there was a very strong syphilitic miasm in the background, in the influence. And finally, he had come to us with this deep vein thrombosis and the degeneration of the disc in the vertebrae and the hips. We gave him calcarea floor. Calcarea floor is a very important remedy for venous involvement. Calcarea floor is also a very important remedy for growths in the bones, for degeneration, for osteophytes, for arthritis. So the remedy that we thought for him, and also we found there's this fear of poverty. He was worried that he's going to become poor and he won't have any money left. So on the basis of this background and the pathology that he was presenting with, we gave him calcarea floor in the 30 potency. This was repeated quite frequently, and we asked him to get the color Doppler studies done at least once every month. He was also following up with a surgeon who was handling him. Of course, he was not being given anything else because they had given all the medicines for thrombosis and there had been no effect. And they were considering finally operation to see if they can get rid of the whole clot. But that was going to be a very prolonged and possibly a dangerous surgery. And that's why they turned towards homeopathy for this. Now you can look at the slides. If you compare it with the previous ones, you see that everything is either red or everything is blue. There are just a few spots where there is some reflux happening, but otherwise you see that it's completely unidirectional flow. It's all in one direction with no change in the colors. If you compare it with the previous one here, you can see that the colors, there are different colors coming up because of the fact that there is bidirectional flow and there is a reflux that is occurring. So this patient's final color Doppler showed complete recanalization in the previously reported thrombosis involving the left leg veins. He was completely on homeopathy. And the posterior tibial vein is also completely recanalized. So without the use of thrombolytic drugs, without getting any surgery done, we were able to help this person recover completely. And he went back home walking with no major complications at all. At the same time, his backache also recovered completely. So this remedy worked at the constitutional level. It helped with his emotional state. It helped with the pathology. And it took care of both the arthritis in the joint or the degeneration of the lumbosacral region, as well as the deep vein thrombosis. This is another very interesting case. This boy actually came to my OPD straight from the railway station. He came from Uttar Pradesh and he was brought with a history of conversions for the past 2 years. He also came with a CT scan, which helped us, which had the diagnosis very clearly mentioned. But these conversions were coming uh, about once in 4 or 5 months. Sometimes his eyes used to roll up, there used to be frothing at the mouth, he was restless and unconscious. Usually these occurred in his sleep, and each episode was followed by fever and vomiting. So, fever and vomiting were also a part of his conversions. Now, occurring during sleep, you would think of drugs like Bufo, there are many other remedies, but there was something else much more important on which we made this prescription. So, with the fever, with the seizure, he would have a headache. The seizure would last for only 4 to 5 minutes. There were no auras. So, when there is no aura, you might find that it's not going to be easy for you to find the remedies, because almost all our remedies like cuprum, etc., have some aura, and this patient had no aura. His last episode was on July 1, 2008. When we examined him, everything was normal. His CNS was normal, higher functions were normal, his tendon reflexes were 2 plus, that means normal. His plantars were flexors, so there was no major degeneration of the CNS, or at least the spinal cord and the reflex tissue. Now, this is the CT scan that he came with. And if you look at the CT scan, in the frontal region, you see this circular spot. And there is a lot of edema surrounding that. Now, this, I'll show you another, which is a close up. So, this is a sort of a granuloma that he had. And the commonest granuloma that you can get mainly in India is tubercular granuloma. And his report also said there's a conglomerate ring enhancing lesion in the left frontal cortical region with associated perilesional edema simulating inflammatory granuloma, and the radiological possibilities are tuberculoma and neurocysticercosis. Now, we asked about his history of non-vegetarian food, and that was ruled out. And we found that he had also been seen by a neurologist in the past who had confirmed that this was a case of tuberculoma. So there was a tubercular lesion in the brain which was causing these seizures. The homeopathic remedy that we gave him was iodoform. So now we are given a specific remedy. The first case was an acute remedy. The second case, where there was a major pathology, there were two pathologies, we gave a constitutional remedy. And here we have an even more dangerous condition to deal with, where a rare remedy called iodoform was given to him. Now, I just want at least the students to realize that there is nothing like a rare remedy. A rare remedy is rare only because you do not know about it. The very fact that it is mentioned and it has been proved by somebody means it is a remedy that is important. So every remedy has its own importance. Nothing is rare. Nothing is very common. If it is rare, it is because you have not read it. But it is always important to remember that you must keep reading your homeopathic materia medica every day. When I was a resident in my hospital for almost 2 years. Every night, I would either read Boric, or I would read Clark's Dictionary of Practical Materia Medica, or I would read Farrington. I would spend at least 1 hour at night, more like a bedtime story. Read, read, and read. That is the only way you will find that you can improve your knowledge of the Materia Medica, and then you can apply it very well in practice. So, what is iodoform? Iodoform is a remedy that should not be forgotten in the treatment of tubercular meningitis. There is sleep which is interrupted by sighs and cries, and the patient is very drowsy. This reminds you of apis. It also reminds you of Helleborus, where there might be a chill piercing cry. But in those conditions, there is more of encephalitis caused by other conditions, or there might be some amount of hydrocephalus. But here we are dealing with a person who has actual tuberculosis. The pupils in most of these patients are dilated, they contract unequally, or they react poorly, and sometimes they have double vision. You'll also find that in the abdomen, for example, chronic diarrhea with suspected tuberculosis. So this is a remedy which is very important for tuberculosis, but it has a specific action on the brain, and it affects the brain and the meninges. So this was a condition where iodoform was given, and now I will show you what happened to him. So we followed him almost at regular monthly intervals, and after a few months, after about 4 or 5 months, he was asymptomatic. He had not had a seizure. Usually at least once in 3 to 5 months he would get a seizure. He decided that he would now like to go back home to his hometown in Uttar Pradesh. So we decided, let's get his CT scan done. If his CT scan shows some positive changes, then we can let him go. We also found that his weight had increased. He was gaining weight. There was a general sense of well-being, and there were no fevers, no seizures ever since he started on homeopathy. He was not on any anti-cox treatment. We had not given him any allopathic treatment for his tuberculosis. He was only on homeopathy, and he was under our observation. They were living in some rest house, and they used to keep coming regularly for their follow-up treatment. Now here is the CT scan of the same patient, and you can see that there's just a small scar that you can just barely visualize in some of the scans. You can see that just a small calcified spot. You must remember that usually tuberculosis always heals with calcification. So that big ring enhancement, you can see there's no edema now around the tissue in the brain, and all that was remaining was a small spot of calcification, which was a scar caused by the tuberculosis. So this is another condition which was otherwise a pathological state, where only homeopathy was given and the patient recovered completely. We could let him go back home, and that took care of it. No anticox treatment and no recurrence of his tubercular meningitis. Now this again, I was made aware of this remedy mainly because, again, our principal, Dr. Anil Bhatia, had treated one child who was brought from a leading hospital in Mumbai. She was brought in a stretcher, and she had been diagnosed with tubercular meningitis. She had not responded to the usual anti-TB treatment that the allopaths had given, and they decided that now it is not worth it keeping her there. They were just paying a lot of money to the hospital without any actual help to the child. She was, I think, about 8 or 9 years old, and she was brought to our hospital. She was almost unconscious, and the parents had a lot of high hopes because they had heard a lot about homeopathy, and especially about our principal. And he gave iodoform to this child. He had given iodoform in 30 potency. So I learned from him because I was a registrar in the hospital. I was seeing that child every day. I was monitoring that child's progress. And I'm sure you won't believe it, because I did not believe it when 1 month later she walked back home, completely conscious, with no post-residual, any paralysis or any neurological deficit. She walked back home with complete normal intellect, with no damage to the brain, no damage to the peripheral nerves, and that was the response to iodoform. So always learn, always try to pick up things that you see from that others have treated, and use that, keep that in your memory, and use that always in the future. So as you can see in this case, the CT scan of the head shows no evidence of any abnormal area of altered attenuations is seen. in the supra or infratentorial compartment of the brain. Conclusion: this is a normal study. So, this is basically the scope of homeopathy in pathology. You, of course, must be aware of what are the what is the scope and what is the limitation of homeopathy. You cannot treat everything, but if you have a good infrastructure and if you have good confidence and good knowledge and you have really been working hard, you should be able to take up such challenging cases and get a positive response. I think I have reached
Yeah,
my
thank you, sir.
3 minutes.
Yes, sir. Thank you,
So
sir, for sharing wonderful cases. And these are not tricky cases. And sharing such cases with the students have really given an insight to the students about the scope of homeopathy, what homeopathy can do. And this is a very important thing. And I'm really thankful to you, sir, for sharing such knowledge with our students, our faculty members, our interns, so that they can know that what they can achieve with homeopathy. Due to shortage of time, we could only discuss about these
no
cases.
problem.
But in future, I want that you can again join and share more things, give more information to our students, so that they can learn a lot from you, sir. So
Sure,
thank you, sir.
I'm always
Thank you,
available
yes, sir,
for sharing
for
homeopathic knowledge. I love to teach and love
thank you, sir.
to.
Now I would request Dean sir to introduce our new guests, Dr. Praveen Swarna sir and Dr. Shobna Shukla ma'am. She is also here.
So thank you very much, sir.
Thank
Vijay
you. Thank
Vaishnav,
you for
sir.
inviting me.
It was a very knowledgeable topic which you have discussed with us, so all the faculties and students can learn from your side, sir.
Thank you.
Really, I am once again, thanks to you.
Thank
Namaste,
you.
sir. You please remain here.
It's beyond 10 o'clock at night, so I'll have to leave now because I have to start with
Yeah.
my clinic early morning. Thank you very much for your invitation.
Thank you, sir. Thank
Okay.
you.
Yes.
Good night. Bye.
Praveen, sir, I welcome to you. Please,
Good morning.
good morning. Please, sir,
Good
start
morning.
your topic.
Sure, sure. Dear friends, good morning. It's a great pleasure
Good morning,
to be
sir.
one among you
Good morning,
to
sir.
Yeah.
present on research. I am trying to share my topic.
Yes,
Okay,
sir.
is it
Okay.
visible?
Yeah.
No, sir, the
Right.
topic the is not visible at present.
Actually,
Please,
I feel.
no, sir, the PPT is
Is there
not
any
visible.
problem? Some voices I am able.
No,
Voice is all right.
Huh? PPT is not visible.
no, sir, not
Yeah.
visible.
Can I go ahead? Shall I go ahead?
No, the PPT is still not
Yes, sir.
visible, sir. If you could share the PPT with us, then I will play the PPT and you can just narrate about the PPT, sir, if possible.
No. Do you want me to send it to you?
Yes, sir. Then I will play it from here, and then you
No,
can easily explain.
I get you. No, no,
If
please come
possible,
again. I couldn't get you.
sir, your PPT is not visible actually, so there might be some technical problems.
Uh-huh.
If please mail
Okay.
it to sir mail ID, and I will play it from here.
Okay, done. I'll do that.
Yes, sir.
Then we may have to bear with this technical snag. Okay, first
Just
I'll
mail
enter
it
into
first.
mail
Just
ID.
mail
Please,
JBS. Yeah,
please give me mail ID. 1 minute. 1 minute.
please.
One minute, sir. 1 minute.
Okay, sir.
Let me open the mail because I haven't opened since morning.
Okay, sir.
Taking some time. Yes. Please tell me your email ID.
JVN DRMP Sharma
JVN
DRMP Sharma
DRMP Sharma
Sharma
SH
SHARMA.
SHARMA.
Yes, sir. At the rate.
Yeah, I have that.
Okay, sir. Please forward
Yeah,
the
yeah,
email.
I have that.
Yes, sir.
1 minute. I'm just attaching that. Just getting attached. It is given here your file is larger than 25 MB. It will be sent as a Google Drive link. Is it okay?
Okay, sir. You can just share it. Give the editor right. You just provide us an editor right, and it will be fine. So that I can download the PPT.
Will it, those technical things, I'm sorry, I'm not fully aware of it, but I am just attaching to the mail. You please check it. If it
Okay, sir.
is causing any problem, then you guide me, I'll follow it.
No problem, sir. It will ask for the permission now, and just give the editor rights.
Yes.
Where will be that editor ID? ID means?
When you press send button, then it will ask.
Okay, so no, if it's send, I'm sending it.
Okay,
You
sir.
please check, have you got it?
Okay, sir.
Now, allow, share with people. Allow anyone with the link to view, right?
To
Okay.
edit,
Oh, you
editor
got it,
right,
right.
editor right, sir.
I've given it. I said allow. It is given there, allow anyone.
Anyone with
I
editor
sent
rights,
it.
sir.
Is it?
Third
No,
option,
could
sir.
you? No, the third option is not there.
I have received the
You
PPT, sir.
please open. No, no, you please open. Are you
Yes,
able
sir, I'm
to open
opening
it
it.
or not?
Yes, I have received it.
No,
I'm
please
just
check it.
opening it.
If it can be, if you can open, there is no issue, no?
Okay, sir. Just a moment. I'm just doing it, sir.
Okay, doesn't matter. In the meantime, I'll talk to the people.
This is actually
Am I
153
am I
MB.
visible?
Yes, sir.
Okay, done.
It is just opening, sir. I'm just going to share it with you. Um,
Are you able to open?
uh, I have shared the PPT. Can you see the PPT, sir?
I'm
Yeah.
not able to.
Yes.
Can
It
you
is
see the
open.
PPT now, sir?
No, I can see only big screen.
Can you see the PPT now, sir? I have shared your PPT.
Yeah.
Is it visible to you?
Okay. Now I can't control. No, you only can control, right?
No, you just ask me to change the slide and I'll change the slide, sir.
Done. 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 Thank you. So good morning, dear friends. Sorry for that small technical snack. It's a great pleasure for me to be here amongst all of you, great stalwarts of homeopathy from the university. But today, I would like to share with you my research work, which I have done in 2012 to 2014 with the help of Indian Institute of Chemical Technology. The then director Dr. S. Chandrasekhar, now he is the DST secretary in Government of India. So he asked me a question. At that time in 2012, Ebola viral infection was very rampant in Africa and other nations. She asked, why don't you treat? I said, there is a wonderful remedy in our repertory and I feel that should be the remedy. He said, how does it work? I said, it is none of my business. I never questioned my authority, my books. So that is up to you because you are a scientist. So he immediately agreed, let us do research. Then that's how it started, that journey. 2 years they did a lot of research work on that. I'll give you the gist at the end of it, like how it has happened. 2 years they have struggled, they have taken different samples, initially pills, then dilution, then all those different methods according to their own protocol. And on a fine day in end of 2014 or so, they called me to their ISCT in Hyderabad, and they all stood up and clapped and said, your drug is wonderful. It has prevented the reverse transcriptase. So it has inhibited the reverse transcriptase. And this drug was Crotalus horridus. That's a please change. So this is of course more important. This is very valid. Next slide, please. What I felt when we have done the research there, that was in the lab. In what way it is useful to the humanity? If I have gained a knowledge, it is very essential for me, but if it is not applied, it cannot be called as wisdom. So I can't be wise. And when I get wisdom, then I would be very happy. Everybody, every one of us. That's how that motto. I thought it should be helpful to the humanity, mankind, whatever research work we have done. Please, next slide. This is what we have done, that in vitro research on HIV virus. And we all know there is only one viral institute in Pune which has live HIV virus for investigations, but they don't give it out. They don't let it go out. There are a lot of protocols, a lot of problems. Being even ICT director, he went 2 times to Pune Virology Institute, but yet he could not get. Then he said he has viral template. So he wanted to do research on Ebola virus, but he did not have Ebola virus. He could not get that. Then he said Ebola, hepatitis B, and HIV. All 3 viruses use reverse transcriptase. That is an enzyme. So that enzyme can be used, and if at all your drug inhibits, so it does the same for Ebola, same for HBV. That's how he confirmed. He concluded, and then the research started. Next, please. Next, please. There were 2 scientists, Dr. Ramesh Umani and Dr. Prathama. So we have tied up with CSIR ISCT, and we have taken up this research work in ISCT Hyderabad. Next, please. So what should we do? We know there are important 3 RT viruses, reverse transcriptase using viruses. One is Ebola, the other is HIV, the third one is hepatitis B virus. So if one drug works on this, it may work. It is not compulsion because it is individualistic. But for his research to be done, because he was aiming through the reverse transcriptase. And mind well, most of the allopathic antiretroviral drugs are reverse transcriptase inhibitors. Later on, they have gone a step above and they are doing a lot of research on different issues. Anyway, next please. So now what is that? In vitro, how do we do reverse transcriptase inhibition? So reverse transcriptase is an RNA-dependent DNA polymerase enzyme, which synthesizes complementary DNA. We call it as cDNA from RNA. Because HIV virus is an RNA virus and hepatitis virus is a DNA virus. Ultimately, they have to convert themselves into DNA for replication to make into virions, hundreds and thousands. So in the present experiment, what we have done, the submitted compound, the compound homeopathic drug, is expected to be a reverse transcriptase inhibitor. It should inhibit. Next, please. So, in order to assess the compound's activity, our drug's activity, the compound was tested by synthesizing complementary DNA in its presence. What we have to do is like in its presence in vitro, like you take homeopathic medicine and you create the environment in such a way that you can create complementary DNA from RNA. If it is synthesized, it means this compound has no action on the synthesis of complementary DNA. That's how the experimentation was done. So, as a control, nuclease free water was taken, and then activity was tested by incubating the compound with enzyme and template RNA in a reaction mixture containing complementary DNA synthesis buffer, oligo-DT, DNTP mix, and RT enhancer. These are all the things like the environment has to be created. For that, the RNA to be converted into complementary DNA. Next, please. So we have selected Crotalus horridus. You may ask me a question, why among those many drugs, why Crotalus was selected? There were few papers published on Crotalus horridus earlier that's efficacy on HIV, but not very conclusive ones. That's number one. Number two, as I said, the whole thing started from our discussion between me and the ICT director that why not we treat Ebola infection. So that Ebola infection, when we have seen in Robin Murphy's repertory, Crotalus horridus is one of the best remedies mentioned there. So I thought Crotalus horridus, snake venom, should be very useful. That's how we have chanced upon Crotalus horridus, and I procured medicine from 5 different pharmacies, Wilmer Schwabe, Bioforce, SBL, Baxons, and Ramakrishna Pharmaceuticals of Hyderabad. So now we all know the dilution contains maximum amount of alcohol. So it was put for evaporation and thus obtained material which was used for the experiment. Mind well, I could only provide the medicine. All the rest of the experimentation was done in IICT laboratory in Hapsiguda with their own protocols, their own thought process. Here I am a novice in this type of research in this field, even now also rather. Next, please. So we all know Crotalus horridus, rattlesnake, very venomous, available in United States, very high venom yield, and it can be neurotoxic, it can be hemorrhagic, it can be proteolytic, it can have all the actions. There are quite a number of different types of enzymes present in this snake. Next, please. So this is the whole essence of our experimentation, what we have done. RNA from cells was extracted. Then it was synthesized, synthesis of complementary DNA from the RNA. That is how it has to be done. For that, the reaction 1, we have taken compound is Crotalus horridus. Here we should remember there is a note given there. Please read that. The complementary DNA synthesis kit used in the experiment contains reverse transcriptase of viral origin, especially from HIV viral template. And if the reverse transcriptase is inhibited, complementary DNA will not be synthesized. It is very simple because the RNA virus uses reverse transcriptase enzyme to synthesize complementary DNA. Then only that DNA will be split into many virions and virus will be replicated into millions and millions. So in the reaction 1, we have taken compound, that is Crotalus horridus 30. Why 30? One point here. I could not go down into the lowest level possible. In the pharmas available here in Hyderabad, 30 was the lowest potency available for me. So I could not procure anything. They wanted 6 at least. I could not get Crotalus horridus 6 at that time. So Crotalus horridus 30, reverse transcriptase enzyme from the cDNA kit, and then RNA template, that HIV viral template which contained RNA. In the second block, it is a reaction to nuclease free water which is used as control. then reverse transcriptase, and RNA template. Now, complementary DNA analysis is obtained. We have to do that now. Please, next. So, what we have to do in order to confirm whether DNA has been synthesized or not, the reaction mixture was analyzed by checking the amplification of constitutive gene in the complementary DNA mix. So, they have done DNA ladder, which is the control one, 1 kb. It is there in the instrument, which is already present there. So, it has to match there. Lane 1 contains our Crotalus horridus 30. Lane 2 contains nucleus free water. If you see lane 1, there is no complementary DNA synthesis. It has not been synthesized. That is the reason why lane 1 is very blank. But when you see lane 2, there is cDNA synthesis in the presence of water. So there is an amplification of constitutive gene. The gene has been amplified. That indicates complementary DNA has been synthesized in lane 2, which indicates that nucleus water would not control. That is a control. Next, please. So what is our inference? The result is like the absence of amplification of constitutive gene in reaction 1 confirms that the complementary DNA synthesis was inhibited, thus concluding that the compound inhibits reverse transcriptase enzyme. Next, please. So, inference, Crotalus horridus has inhibited reverse transcriptase 100%. There was no speck of it, 100%. And thus can effectively inhibit the growth of HIV virus because it depends on reverse transcriptase. And also Ebola and hepatitis B viruses in the affected patients, and hopefully it can cure them. As I told at the very beginning, that the knowledge what we have acquired, if it is not put to proper use and if it is not put to the society, there is no use. And I have requested the government of Telangana at that time, and they have permitted. At that time, the then health minister of the government of Telangana was homeopathic doctor. He gave permission to start a specialty clinic in our JSPS Government Home Medical College here in Hyderabad, for which I was the principal. And there we have established a specialty clinic, and you would be very happy to note that till now, more than 54,000 patients are registered in that specialty clinic, and they are taking the treatment, and they are finding wonderful results. And before I retired, as a government employee, I had my own apprehension. So I entered into an agreement, memorandum of understanding with CCRH. They have taken over to a greater extent. They are running that specialty clinic at JSPS, and they have appointed the research officers, statisticians, and in fact, I'm so happy to announce also, they have established a lab almost for CD4 count and viral load, because they are the most important parameters in assessing HIV patients' progress, where subjective feeling of well-being is not sufficient. So we have to see. More than 2,500 patients are there with me in my clinic, and around 33% of patients are exclusively on home medicine for one reason or the other, in spite of CCRH mentioning very clearly, as per Government of India instructions, they must have ART, then only they will be given homeopathic medicine. In fact, personally, I'm against it, but as per the Supreme Court judgment and Government of India rules, we have to ask the patient to take ART, then only we should take. But we have some solace there. Some of the students, some of the patients, if not all of them, they develop lot of severe reactions after taking ART, and they cannot go ahead with that. They stop it. So we have a fertile soil there, a beautiful point there, where 33% of patients are exclusively on our medicines, and without ART, with only homeopathic medicine, they are improving a lot at symptom level and even CD4 and viral load. Next, please. So next, we have quite a number of cases, plenty. This is Western blot negative. This is the ultimate test in HIV. Western blot, all 9 antigen, they are all completely negative. If you give the treatment, in fact, that is my aim all the time, to make negative, zero conversion. It takes a longer time. it needs lot of evaluation later. But this is the greatest achievement from homeopathic standpoint, where we can have Western blot negative in a patient who is under our treatment, which others would not suggest. Next, please. There is one more case. Next, please. There are quite a number of cases. Here also Western blot negative. This is a patient's testimony. Next. Testimony he has given in Telugu. In fact, this man is very happy with negative report. The greatest problem, I tell you, my friends, I share with you. This is also like it is only 2 hour weekly negative, P24 positive and P66 week positive, and it can become negative very soon. It happens also. Next, please. I'll show you. We'll scan through the reports only. I'm not presenting. Here, Western blot negative. One more. Next, please. CD4 improved. Viral load becoming zero is a very easiest thing in homeopathic treatment. And then it became seronegative. Next, please. So here on the right, you can see all antigens negative, 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 seronegative. That's how the report. Next, please. Case number 5. Here also you can see a lot of improvement with the usage of Crotolus horridus 30. Next, please. Case number 6. It shows like CD4, which was like which was 50, and it came to 847. Normal value should be more than 550, and then viral load below detectable limits. Usually they can't give 0 as per WHO instructions. They give below detectable limits or target not detected. Next, please. There, this is what like we have shown again. Please go on. Same patient, 50 CD4. Next, please. So we have given viral load was 11,436, and in 3 months we can see it becomes below detectable limits. From 11,000, it comes down to below detectable limits. Next, please. So viral load after 3 months, it became almost 0, 70, and later it became below detectable. Next. You can go ahead faster, no problem. CD4 847. Next, please. So below detectable limits. Next. Here this is how it is compared. Next. Next. Case number 7 again. Here HIV viral load was 253. We feel 253 is so low because we have seen thousands report. But anything above below detectable limit is a considerable amount of virus only. But as the number increases, it is a challenging task for us. Next, please. So this is how it became. Next, please. Then viral load. Next, please. Same. Next. Some of the labs give less than 172. Some of the labs give less than 36. Some of the labs give less than 40. They have their own different kits. Accordingly, they will give that. Next, please. This is case number 8, where she was not on ART. 2014 onwards, almost 4 years, 3 years. Then for 1 year, she came to our OP. CD4 was only 400, came to 701 later, 1303 later, and virus became below detectable limits. I'll share with you some of practical problems also. First, let me scan through the reports for just information's sake. Next, please. We have thousands of reports. I've scanned through only very few. This is one positive. Next, please. So this is how like CD4, which was 700, became 1300. Then virus became below detectable limit. Next, please. Next, please. You can go faster, sir. No problem, because I can share with you. Next. Next. Virus becoming 0 almost. Case number 9. Next. So again here 11,194 became 0. Right. Next. Next, next please. Next, that's what like we gave Crotalus horridus. Then it became 0. Next, next. So this is how it has changed. Case number 10, unmarried male, retropositive since 4 years, not on ART. 316 was CD4, became 578. 828 copies was HIV, became 0, below detectable. Next. Next, please. These are the reports. Next. Next. Next, please. Yeah, this is how. Next. Case number 11. So 316 became 578. Next. Case number 12. Viral load, which was 828, became below detectable. Next, please. Now, case number 13. The viral load was 68,30,893. 68 lakhs, mind well, per ml of blood. And you can see the dates, 2nd December 2015 and 31st July 2016. It became 0, below detectable limits. Now this is HIV non-reactive in a case. Next, became negative, non-reactive after the treatment. Next, please. 9-year-old girl converted, seroconversion, completely negative, negative, negative. This girl was a journalist's daughter. It was vertical transmission. She has been on ART for quite some time, developed severe complications, and they have stopped it. So we have given exclusive homeopathic medicine. Next, please. Now, here, male 53%, female 46%. Transgender, we have 18 cases of transgender. And I should also share with you, we have no exception from occupation. I have 2 priests from temples. I have 5 pastors. All of them have HIV infection. So your profession, your religious sentiments, your understanding, your preachings, they are no bar for getting HIV. It can be through various phenomena. But here I tell you, sexual contact confirmed in 30% cases only. And 54% of people, they say unknown. And among them, quite a lot would be because of sexual contact only. But they will tell some cock and bull stories. So we have to listen, and I can't attribute everybody to a sexual contact. There were vertical people, blood transfusion cases, unsafe injections. So likewise, these are the usual modes of transmission. Now, if I have seen 45% of patients, viral load became below detectable. We can check in college as well. And till I was there, till I was following, even through my wife, who was also professor there, she was made in charge there. She was also providing me the statistic. 45% minimum, their viral load became below detectable, whatever might be the level. 38% of patients, whether at Hyderabad, now of course JSPS is different because they are insisting on ART because of CCRH connection. In my clinic, 38% of patients are exclusively on homeopathic medicine. There is no ART. Next, please. Now, these are some intriguing facts which are difficult to be understood and digested. 5 cases in which wife is positive, husband is negative, yet they got a child who is negative without using any treatment. All 5 of them risk their life. I admit here, I am not having 100% confidence. I think I have 5 more minutes. 100% confidence I am not having for preventing vertical transmission. So I insisted on them, whoever comes with pregnancy, I tell them, please take ART. They have a separate remedy which prevents vertical transmission. But these 5 were very adamant and they used only our remedies and they got a child without HIV. And the other important aspect, husband still maintaining negative. This we cannot explain from medical point of view. There could be some percentage where he may not contract, others may not be transmitted. We have to yet to find an answer for this. There are hundreds of cases in which CD4 was above 500, yet their viral load was in thousands or lakhs. Why am I mentioning here? Because till 2016, the WHO norms were that if the CD4 was above 500, they don't need to be treated. They were not treated. But I got hundreds of cases with viral load very high in spite of having CD4 above 500. So that's how I wrote a letter to WHO as well. These are the startling facts. Please consider. I'm not saying that because of me they changed the protocol. For them to change the protocol, it would take lot of time. But I had a satisfaction after that. They changed now. They don't depend on CD4 to start their ERT. Similarly, there are a lot of cases with viral load below detectable limit, but CD4 not that. Please go back. Please go back. So CD4 was very low. So these two are dependent, but they can be independent as well. We have to be careful, insist on the patient to have both the things. And the lowest CD4 report I have seen so far is 4. And my own son, who is a neurosurgeon, he really got shock of his life. He said, "How come this patient walked into your chamber?" I said, "Yes, he came and he's alive. There is no issue at all." And the highest viral load I got so far is 2.42 lakhs. So this is highest so far. Nobody could beat it. So we have so many such cases, and so far 38 cases zero conversion has occurred. But as I was telling you, among our results, I can share one important aspect with you is that whenever I see one, I insist on the patient whenever he gets registered with me, there should be 3 consecutive negative reports. Then only I'll put you to some evaluation by a special team, and then we will declare. Everybody would nod the head, and the moment they get a negative report, they will vanish. Their phone number will not be accessible. All the 36 so far, I have no access to them. I have the reports, but it's of no use. Only report a paper for my satisfaction, for scientific circles, little side, but it cannot be scrutinized. It cannot be evaluated further. So that is the greatest bottleneck for this research. But sooner than later, we will get all those people, everybody, and then we will get those things. So that's how I feel we are heading for a breakthrough through homeopathy on HIV. We can probably cure it and tell the whole world that homeopathy can cure HIV oblique AIDS. Thank you very much. Thank you, Dr. Prasad Sharma, and all Dr. Ravi Jain and everybody. Thank you very much.
Thank you so much, sir.
Thank you, sir. Thank
We
you for
have
sharing in
listened
such a
your
wonderful. Yes, sir, Dean, sir, please.
knowledgeable
Yes, sir.
research project which you have shown
Yes,
to
sir.
us. So all the students and faculty member and others, they can understand, they can go through the homeopathy as in research work which you have done. Very fantastic. Thank you so much, sir. Again, once again.
Can I add one sentence? Thank you, thank you, thank
Yeah.
you. Can I add one sentence? I request all the fraternity, homeopathic fraternity, young doctors, everybody, please use Crotalus horridus 30 and get back to me. You will get success. Definitely.
Thank you so much.
And there are quite a number of cases in which we have given only constitutional remedies. But if we get the time to take the whole case, which will not happen in my college there, because there will be 6 tables, hundreds of patients. So it is a monotonous allopathic type of prescription. Many people criticized me, but this is one way of doing research. We cannot say that we take the whole case and give and all that. Thousands of cases every day. So we can't manage the number with taking the whole case for a long time. All the pages would sit there. Earlier, Thursday used to be the day of AIDS day. In the whole area, everybody understood AIDS day. They used to line up from 1 o'clock, 2 o'clock in the morning. Now we make 6 people are coming. So I request all of you
Okay, we will
HIV and
touch with
get back in
you.
top. Thank you.
We will touch with you as and when we will discuss about the cases. You please remain with us. Thank you so much.
Definitely. Thank you. Thank you. Thank you.
Thank you,
Thank you.
sir. Thank you, Dr. Praveen Suvarna, sir, for a wonderful presentation. Now we have one more renowned guest with us, Dr. Shobna Shukla, ma'am. And
Yeah.
it would be our great honor, ma'am, and great privilege to hear from you. Over to you, ma'am.
Thank you so
I
much.
welcome I welcome to Somna Shukla ma'am. Please, in our second day session, you please start your topic.
Okay, thank you, sir. Good morning to all of you. I am Dr. Shobna Shukla, professor and HOD in the Material Medical Department in Bhopal GHMC. And I was joint director in Ayush department in the state of MP. And I worked there approximately 4 years. So my topic is today's my topic is advancement in the homeopathic research, including clinical trials, laboratory researches, and the case studies. So first we started with the introduction. रिसर्च सभी लोग जानते हैं कि रिसर्च क्या होता है, पर फिर भी थोड़ा सा मैं बताऊंगी. रिसर्च इन होम्योपैथी इज नोन since antiquity and has been carried in one form or another. The first basic things Hahnemann did to prove that there exists a science beyond the materials was was by means of the experimentations and observation, observing it to the level of the criticism and analyzing it to the depths of the history. Hahnemann develops homeopathic pathogenesis trials. Uh, that short form is HPTS, often referred as drug proving, and reappraise them in the light of the more recent knowledge and protocols of the clinical trials involving human subjects. Innovative feature and method introduced by the Hahnemann and aimed at the reducing bias are noted. This clearly proves the insight of Hahnemann to accept challenges with outlooks and to adopt the facts. Clinical researches is one of the growing activities in homeopathy in the past few years. The concept of the evidence-based medicine has evolved in conjugation with the clinical researches. There are many peer-reviewed, published studies and meta-analysis supporting basis fundamental and evidence-based character of the homeopathic researches and have contributed substantially taking homeopathy to newer heights. Hahnemann, who himself researched into the history to prove the theory he discovered. There are numerous examples of the research activities which one can find while going through ancient writing and the teachings. Hahnemann writings, case studies, his mode of living, etc., are now studied with in-depth scientific attitude to the extract inner information he applied. This will help us to present our concepts in more adequate manner. Drug proving or human pathogenic trials is to the core area we aim for. This is the process in which drug substances are put into trial over healthy volunteers and their pathogenic effect are observed and noted. Therapeutic process जो कि हम मटीरिया मेडिका में हमेशा पढ़ते आ रहे हैं कि कैसे ट्रायल्स होते हैं, है ना. Therefore, it is the only and unique method which is based on the nature's law of cure similia similibus curanter and like cures by like. काटा काटे को निकालता है, एक काटा लग जाता है तो उसको हम सेफ्टी पिन से ही निकालते हैं. ये हमारा एम है होम्योपैथी का एंड दैट्स cures like by like. Drug capacity of the eradicating a disease lies in its capacity to produce the same. Hahnemann preferred proving drug substances on himself and his trusted fellow man. Hahnemann ने जो भी ड्रग प्रूविंग किया उन्होंने अपने ऊपर किया पहले और उन लोगों पर किया जिस पर उनको लगा कि ये सबसे ज़्यादा फेथफुल है. All these provings are either open or single. Blind Hahnemann knew the medicine he was proving on himself and others. With passage of time, however, things changed. In order to eliminate false signs, symptoms, and subjective bias, Drysdale proposed the double-blind method for the proving of the drug. in health volunteers and where neither the proving master nor the prover knew the name of drug conducted for the proving. ये तो हम हमेशा से पढ़ते आ रहे हैं, बहुत सारी बुक्स में भी हमने पढ़ा हुआ है कि उनका प्रूविंग का मेथड क्या था. In 1996, Flavio Dantas coined the new term of the drug proving, homeopathy pathogenesis trial (HPT). HPT is the first systematic experimental approach to detecting changes in the healthy volunteers after exposure to a drug. HPT is a clinical trial to investigate the effects of potentially toxic pathogenic substances diluted and according to the homeopathic pharmacopoeias in non-patient volunteers is relatively stable health conditions. Drug proving techniques have been by Hahnemann some 200 years ago and have been rectified and updated time to time, जिसको कि हमने Hahnemann ने समय समय पर उसको अपडेट करते भी गए. In the recent time, the process of the methodology of HPTs has improved greatly. Recent published guidelines on drug proving have strength HPT practices around the globe. The technique must be unified to yield replicate true symptomatology of drug to make clinical proving and research more authentic and scientific. Clinical verifications are now carried at multi-centric level. This helps us to gain finer shade and remedies in the term of climates, populations, etc. Fundamental or philosophical researches in one of the areas of interest of the historians and many clinicians. Drug standardization, aphorism 122 quotes, in these experiments on which depend the institute of the whole medical art and the will of all future generations of mankind, no other medicines should be employed except such as the perfectly well known and whose purity, geniusness, and energy we are thoroughly assured. The aim of drug standardization is to ensure quality, geniusness, authenticity of raw drugs and to evaluate the safety and efficacy of the drug. The accept of prime importance of for all our future confirmation with the scientific fraternity. All the research is old as homeopathy is utility has been observed in past few years. फिर हम अगर आते हैं रिव्यू आर्टिकल्स इन द बुक्स पर, तो वी कैन सी कि द फर्स्ट सिस्टमेटिक रिव्यू वाज पब्लिश्ड इन 1991 of the 105 trials with interpretable results. 81 indicated positive results मिले हमें वहाँ पर, which included RCTs and received high quality rating of the randomization blinding, sample size and other methodological criteria हमारे पास थे. The authors came the conclusion that based on this evidence, we would ready to accept the homeopathy can be more efficacious if only the action were more possible. And presented in this view would probably the sufficient and establishing homeopathy as a regular treatment for the certain indications.
Thank you, ma'am.
Second thing is that in 1996 May, a book was published. A
Dr.
book was
Shobna,
published.
ma'am, sorry
Yes.
to interrupt you, ma'am. Extremely
Yeah.
sorry to interrupt you. मैम प्लीज़ अगर आप इसे ब्रीफ में बता पाएँ बिकॉज वी ऑलरेडी हैव सेट शेड्यूल
हाँ,
सो
हाँ.
अगर I would request you to kindly be concise
Okay.
and please tell us in a very brief because our next speaker is also here, Dr. Padampriya Nair ma'am. She is
Yeah.
also here. So I would request you to kindly be brief and please, if possible, you can explain it in your own words, ma'am, so that the students can also understand in an easy way because
Okay.
most of the spectators are students only.
Okay.
We
Okay.
have our students, students, BHMS internees, we have faculty members.
Okay.
So
Okay.
it would be good if you can just tell us about the summary or the brief of
Okay.
this particular thing because so that the student can easily understand.
Okay. 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 So when we came on the some some of the studies worth to mention here are कि अगर हमने कोई भी drug proving के लिए किसी को भी लिया है तो that are the healthy human beings होने चाहिए. और Hahnemann methodology of the drug proving क्या था? Hahnemann used non-blind trial method of the proving, not using a control group placebo. He's proved drug on healthy human being on both sexes, various age, called classical proving by the Hahnemann methodology. है ना, both sexes पर उन्होंने प्रूव किया और अनबायस्ड लोग होने चाहिए थे उसमें. ऐसा नहीं कि है ना अपने सिम्टम्स को या साइंस को वो एक्सागरेट करके बता रहे हो. वो सारी चीज़ें उसमें आई थी. आफ्टर Hahnemann after the study of the proving, Hahnemann homeopathic drug proving is one of the researches in homeopathy which based on the science and physiology. तो टेस्ट ऑफ द सब्सटेंस होना चाहिए उसमें, प्रूविंग टीम होना चाहिए, मेथोडोलॉजी पूरा परफेक्ट होना चाहिए. अब सबसे पहले बात आती है कि टेस्ट सब्सटेंसेस क्या होने चाहिए. द डिटेल अंडरस्टैंडिंग इन द ड्रग दैट इज टू बी टेस्टेड is very important. The principle of the single remedy forms of the basic feature of the proving. हमको single remedy पर ही हनीमन ने प्रूव करने के लिए इंडिकेशंस दिए थे. Here we should be aware about the source of drug, its in the scientific languages, in the method of preparation, its pharmacological characteristic, properties, potency, uses and toxicological effect, etc. देखने होते थे. The potency should be used as susceptibility of the patient. Potency हमें कितनी यूज करनी है कि पेशेंट कितना उसके लिए ससेप्टेबल है. तो पोटेंसी, यूज ऑफ पोटेंसी, अगर हम फार्मेसी में जाते हैं तो एक चैप्टर आता है पोसोलॉजी. तो पोसोलॉजी के अंदर हमको बताया जाता है कि हमको किस पोटेंसी में कितना किसी ड्रग को देना है. तो दिस वेरी अपॉन द हर एज, हर मेंटल स्टेटस, फिजिकल कंडीशन एटसेट्रा. कि प्रूविंग टीम के अंदर अगर प्रूविंग टीम को हम देखें कि प्रूविंग टीम हमारे पास कौन कौन सी होनी चाहिए, तो फर्स्ट ऑफ ऑल प्रोजेक्ट डायरेक्टर होना चाहिए, उसमें एक एडवाइजर होना चाहिए, एक सुपरवाइजर होना चाहिए. उसके बाद ही हमारी एक प्रूविंग टीम जो होती है वो कंप्लीट होती है. देन वी कम ऑन कि हमारे पास जब एक डायरेक्टर है, एडवाइजर है, सुपरवाइजर है, इसके बाद हमने किसी भी मेडिसिन को कुछ ग्रुप ऑफ कम्युनिटी के ऊपर प्रूव.
Sorry for interruption. Your time is over, ma'am. Please.
Okay. Thank you.
Thank you so much, ma'am, for your marvelous, knowledgeable documentation which you have proved here. Thank you so much, ma'am. Thank you.
Thank you, sir.
Dr. Padampriya Nayar. Dr. Padampriya Nayar, ma'am. I am audible.
Dr. Padampriya Nayar ma'am, if you can listen to us, please turn on your camera so that we can start with your presentation.
I'm sorry. Just give me a minute. I'll just turn on the camera. Am I visible?
Yes, ma'am.
Very big hello to everybody. But before I start, can you please help me, because I just need to share my slide. Unfortunately, I could not. You said
Ma'am,
it's
please,
not working on the.
please open your slide in the background.
Yeah.
PPT, and then press on the present button. Present button at the bottom. Then you please share. Click on share screen. After sharing screen, you have to click on entire screen.
Okay. Yeah, I get that. Okay, fine. So am I visible and audible?
Ma'am, but the PPT is still not visible.
Yes. I just got the hang of how to do it. I'll do that. So big namaste to everybody.
Namaste.
Hello to all the dignitaries present here today. Hello to all the faculty members present here today, and a big fat hello to all the students. So, before I start, I really wish to appreciate the students of your university, because I just wanted to see what this session is all about. So, I attended a little bit of session yesterday. Of course, apart from the best dignitaries you had yesterday, I really salute the girls, and the teachers or the professors who are helping these girls to come on the platform and talk. I could see that many girls were not very confident, but I salute their courage to just sit on the chair and explain the PPT. So, a brilliant congratulations to all these girls. And these girls have changed my mind. Actually, I had a different theme for today's presentation, but overnight I changed the presentation just to give something, something different to the girls here today. These girls reminded me of my days, because I was very shy, timid, quiet as a student, and unfortunately we did not have this sort of a platform to go and present our case, overcome our shyness and fear into this wide public, so I'm just doing a small little presentation, basically for the students. Of course, it may not be very beneficial for the I'm just trying to share my screen. It may not be very beneficial to the seniors here, but I'm sure this will help the students a lot. Okay, so now I'm sharing my screen. Is it very visible?
Yeah.
Okay. So before I start, Guru Vandanam to all my teachers. I got to learn homeopathy from the best homeopathy college in Mumbai. Now I am here in England, but before this I was in Mumbai, and I got to learn a lot theoretical and clinical aspect from various pioneers in Mumbai and all the dignitaries who had attended Mumbai to give conferences. So Guru Vandanam to all the teachers, and above all, the master who taught me was my own father. Fortunately, I was born into a homeopathic family with around 7 to 8 siblings of my father into homeopathy already. But my father forced me to get into his clinic every day, literally, right from my childhood days. Initially, I used to just sit in his clinic and play with his patients or children's present there. That's how I started my journey. But eventually, before entering the medical college, my dad already gave me an orientation of what clinical homeopathy is. Followed by this, during my later years of graduation, I met this man, Dr. Milind Rao. So I call him my homeopathic mother, because he was a person who taught me how to read books, how to read remedies, how to read repertory. My father taught me how to read the patients. So this blend of how to read the patients, how to read the books actually has helped me a lot. So basically, whatever I'm going to talk today, whatever I'm going to share is nothing but an amalgamation of both my father and my homeopathic mother, my guru. Okay, so I'm keeping it very simple. I'm not going using any hi-fi English. I'm not going to use any hi-fi materia medica or a homeopathic language. I'm just putting it very simple. As I said, it's going to be basically oriented for the students of this university. So very simple. So let's understand basically what is homeopathy. No definitions. Homeopathy is nothing but the power to heal. What we have learned in from our books and from all the sciences is plants has got healing abilities, chemicals has got healing abilities, minerals have got healing abilities, everything around us, thunderstorm lighting has got healing abilities. These days I was listening to a speaker in England. There's a new remedy that has been proved from thunder lightning. Okay, positronium, electron, helium. So all of these have been proved as remedy. So all of these have got healing abilities. And what are we doing? We are the homeopaths who's been given this knowledge about the healing abilities of all these things around us. So what are we doing? We are using this knowledge, the power to heal, to help the patients who are coming to us. Okay, so again, going very simple, I'm moving to what are the basic principles. So when you sit in your clinic, you should have these things ready in your hand. So you have to carry this, especially students, this is not just for your exams or just for to score marks. Inside your clinic, you need to use these laws. Of course, we have 7 laws, so I'm not going to talk about all the laws. I just want to tell you when you sit in your clinic with your patients, the first three laws are very, very essential. Every day, every patient, you have to use this three law. The law of similia, simplex, and law of minimum. So law of minimum is nothing but give the least potency. Like just now the speaker before me, she explained about how susceptibility will help you to find the best remedy. Okay, the best potency. So law of minimum is nothing but the posology part of the story. Law of simplex is nothing but your repertorial totality. You're sitting with your patient is giving you the physicals and the mental. So you have the mental generals, mental particulars, physical generals. So you take this, you take the totality, and there you get one remedy that could be the simillimum. So that is the law of simplex. Again, the law of similia is nothing but a drug has been proved, and let me say I take a drug as a drug prover, I get 10 symptoms. So tomorrow, if you are showing at least 3 symptoms of this 10 symptoms, then you should be taking this remedy. In simple language, I'm explaining. Okay, so this drug proving is, let me choose what is the best similar prescription for you. Okay, but so what I'm trying to say is these 3 rules you have to use with your patients everyday basis, with every patient. But in order to use these 3 rules, we need a ground foundation, the basic foundation of the principle of individualization. So let me say I am coming to you, you have to give me a remedy. But if I am coming with my triplet sisters, my identical triplet sisters, all 3 sisters are coming with, let's say, headache, you cannot give the same remedy to 3 sisters. You have to see how am I different from my first sister, how am I different from my second sister, and then prescribe me. So I am unique, my symptoms are unique, although the headache is the same. Okay, this is again, I'm putting it in a very simple way for the students to understand how we use it in the clinic. Okay, so principle of individualization is the ground foundation based on which you're going to practice homeopathy. Your patients will go back and will bring more patients to you. Your patient will be happy, more patients will come to you if you use these 3 laws in your clinic based on this law of individualization. So for what I want to tell students today is understand properly and very wisely what is individualization, because the whole homeopathy is based on individualization. Okay, so just to make it very simple, in a very simplistic way, I'm giving you one example. Pain. I'm taking pain because 95% of the patients who comes to us, I should say 99%, they're coming to get some relief from pain. It could be any sort of pain. So help me, doctor, with a medicine to take me to from this zone of discomfort to a place of comfort. That means please help me get rid of the pain. Okay, so I'm just giving you this one example. Okay, so I am very sorry about this slide. This is one slide. I'm trying to get the best slide. I could not. As I said, I just quickly made this overnight. My original PPT was something heavy, but I wanted to keep it light for the students. So pain, see, do not focus into the details of this slide. What I'm trying to say is what happens with the pain is the pain first goes and stimulates one place in your external body. Okay, let's say a mosquito bite. So there is an external stimulus that happens. It travels into your spinal cord, and from the spinal cord it enters your brain. Now where into your brain is this stimulus going? It's reaching your limbic system. Okay, the thalamus, the limbic system. So why we need to understand this is because the studies have proved what happens in the limbic system is this stimulus will go and stimulate your anterior cingulate cortex. This is there in the thalamus. So what happens is when you get a mosquito bite, of course you are getting a physical reaction, but there is also an emotional reaction to this stimulus. So what is the scientific finding is emotional pain triggers the limbic system and activates the same neural pathways as physical system. That means if you're getting a mosquito bite, your emotions are also triggered. So you might feel irritated, you might feel angry, you might feel scared. So what is this I'm trying to tell you is when you have a physical symptom, also you have an associated emotional symptom because it is the anterior cingulate cortex that has been stimulated by this so-called pain. Okay. Now, why we as homeopaths have to understand this is because our master Hahnemann has written almost 150 rubrics in the mind section of our repertory. So this is very fascinating to understand why mind has got pain. And if you go into the mind section, it is not pain any of the physical pain. He is talking about the pain which is triggering the anterior cingulate cortex and which is causing the emotional response to your physical pain. This is very, very important, dear students, because I'm trying to tell you how individualization has to be implemented with all of your patients. Okay. So if you look into the repertory, there are many facets of pain. So we have all these expressions of pain. With pain, you will become irritable. With pain, you might become very restless. With pain, you will start getting that fear. Oh my God, is this mosquito bite going to create a dangerous disease for me? Anxiety, what will happen? Oh my God, this pain is very bad. What will happen? So what I'm trying to show you here is, there is a physical symptom, you have a physical symptom, you have an associated emotional symptom or a mental symptom. So what I'm trying to tell you is, this is where the law of similia simplex, when you take the totality of symptoms, you get the physical symptoms, but you also need the emotional, the mental symptoms. Okay. So when you take the totality of the symptoms, so like for example, a patient is coming to you with pain, you have to take into consideration both the right side and the left side of this slide, which means you have to see what happens to the body. Because of the pain, is there less movement? Is there fear of movement? Is there weakness? Is there stiffness? What is happening with the pathology? Is it progressing? Is it deteriorating? This makes your physical totality. But along with that, you have to understand, should not forget to take the emotional aspect of the pain. Like, are you feeling depressed? Are you feeling nervous? Are you feeling very low? These are very, very important. Okay, so just to make it a little more simpler, I'm just giving you one case study that is about the patients of dysmenorrhea. Dysmenorrhea, this is a women's university, so I am just giving this example, what happens with dysmenorrhea and how homeopathically we can understand law of individualization in cases of dysmenorrhea. Okay, so what happens with ignatia patients? Okay, now again, what I'm trying to tell you is, individualization is applicable not only to patients. When we study homeopathic remedies, we need to understand how one remedy is different from another. If we can do this, we can implement this in our clinic, how one patient is different from another. So if you read the Materia Medica mind section of every remedy, you will understand how to individualize this remedy from the another remedy. So ignatia is not going to talk about the dysmenorrhea she is having. Oh, I have to go to my college, I have my lectures, let me go. She will not complain about the pain she is having, because ignatia is very secretive. Ignatia is going to bear all her complaints without any outrage. These are the rubrics that we find in the mind section. Okay, the only thing is, when ignatia is having this dysmenorrhea pain, she might become very irritable, but she will not speak about her the pain, the problems that she's having. She will attend her college, she will take care of her lectures and making notes and all. She will not allow anyone, not even her best friends, to know that she is in pain. What about spigelia? Spigelia is very high spirited. Terrible dysmenorrhea, too much of bleeding, not able to eat anything, nausea, vomiting. No, I don't care. I want to go to my college. I'll sit for 1 or 2 lectures. I'll be fine. And even when she is attending the lecture, she will speak to her friends, have a jovial attitude towards her friends. She will laugh at the jokes cracked. So she will be very cheerful. So this is the individualistic quality, okay, of spigelia. What about chamomilla? Chamomilla girls just cannot tolerate the pain. The patient will be brought by the parents or the friends to your clinic saying that, doctor, please help my daughter. My God, she's so abusive. She tells me, idiot, mommy, you don't have any painkillers. Mommy, why don't you just take me to the doctor? Oh my God, I just can't bear this. Stupid brother, just go away from me. I am in pain. Just leave me alone. You're such an idiotic person. Why? Because chamomilla has this individualistic quality of being abusive. Chamomilla is very sensitive to pain. Chamomilla cannot tolerate any sort of disturbance around, and chamomilla becomes very violent. Lots of wrong languages. If you are sitting in the clinic, the chamomilla can shout you also, doctor, can't you see you're sitting on your phone? You're not listening to me. Just give me some medicines immediately, Impatience if the doctor is not curing him once. This is the presentation of chamomilla. So this is how chamomilla will be different. So what I'm trying to show you here is, we have our physical symptoms. I'm not talking about the physical symptoms at all. I'm talking about how individualization can happen with every remedy and how the patients will come to us. So what happens with plumber med? The pain may not be that bad, but with her friends, no, I cannot come for the lecture today. You see, I'm getting so bad pain. Oh, no, no, don't move me. Let me sit like this, double folded. Oh my God, don't come. No, no, don't move to me. And her best friends, her sisters, her mother can clearly see, oh my God, so much of exaggeration. No, this girl, even we get periods, but we don't have complaints like this. Oh my God, look at her, and she look at the way she's screaming. This is a classical presentation of plumb met. Okay, they just want to exaggerate everything. Alzheimer's patients have got so much of fear of getting injured by anything. They're always suspicious because they have this fear of being betrayed. Oh, should I drink hot water? Maybe my dysmenorrhea will go very bad. No, no, let me not drink. Oh, I don't want to eat anything. I'm already having so much of pain. I might vomit, if I eat. No, no. So they have this fear that this drink might harm me. This food might harm me. So there is that fear of injury that comes with the complaint. What is the complaint? The complaint is the pain, but along with the pain, what is the patient showing is the individualistic quality of that patient. Okay, so because of this, they are always suspicious. Doctor, are you sure this little globule will really help me get rid of my pain? No, doctor, I think you should. Oh, are you sure? Okay, but are you sure this will not increase my pain? This is Alzheimer's, always suspicious. And what about calcarea carb? Calcarea carb is very exclusive. Oh, no, no. Wow. Oh, my God. I having dysmenorrhea. I'm not going for the lectures. That is not possible. Oh, my God. I'm so regular with my attendance. Let me wear nice clothes. Let me wear some bright lipstick and let me make myself look happy and cheerful. What will my friends think? Oh my God, I cannot do this. I know I have got terrible pain. I'll carry extra pads and painkillers in my bag, but I will not miss my lecture. Why? Because she feels that what will the family think? What will be the society or the so-called friend circle has got a reputation about me? What will they think about me? So this is how calcarea will show her individualistic qualities in front of you. Anacardium patients are like, doctor, I've got terrible pain. I really want to go and relax. I don't want to go for my lectures. I don't want to study. I want to go and relax. So when I go and relax, suddenly I feel, oh my God, the exams are coming. I've got so much to study. I've not finished my presentations. I've got so much to read. I have to get up and get my things in order. So rest cannot until things are in proper place. This is the devil in the anacardium who's stopping her from resting. And the angel of anacardium is telling her, okay, baby, you've got dysmenorrhea, go and sleep. Okay, so she is in a state of helplessness. Doctor, I don't understand. I want to sleep. My body tells me go and sleep, but my mind tells me, no, no, I have so much to study. So I feel so helpless. What should I do, doctor? Please do something for me. This is how the individualistic quality of anacardium is seen. Opium, terrible dysmenorrhea, too much of bleeding, too much of tiredness, maybe some associated nausea, headache, and all. No, no, forget. It's an annual event of the school and I have to perform. I have to do my stage work. I don't care. I know I've got so much of pain, but no, I have to. I cannot cancel this. I have to go and do it. That is the courageous attitude. That is the fearless. They don't care about what will happen. Let me see. If something will happen, I'll handle this. But I have to go for this. I don't care about the danger associated with me dancing on the stage for 15 minutes with so much bad dysmenorrhea. I will go and do this performance. So this is the quality. See, what I'm trying to tell you is when you say law of individualization, the important thing is understand how every remedy is different. So this is what you see when you read the mind section of every remedy. Every remedy has got its own individualistic quality. So as students, if you read this, try to use this law even today when you're studying, you will be more prepared. AP's very bad state, too much of dysmenorrhea, too much of bleeding, too much of many other associated symptoms, but they will carry on and they will smile. They will smile and they will keep themselves laughing because I laugh to keep myself from crying. So actually, if you look into the state of APs, it's a wretched situation. Okay, but they will stimulate hilarity. That means I know I am in a very bad state. I know I am in a very messed up situation, but let me laugh and smile it, show that nobody will understand that. Okay. Arnika, my daughter keeps sleeping. I tell her, you're not fine. Come, I'll take you to a doctor. But my daughter, no, she tells me, no, mama, I'm fine. I am well, mama, don't worry. Even when this Arnika or AP's patients comes to your clinic and sits, yes, as doctors, if you're asking, yes, tell me, how are you? No, doctor, I'm fine. Just mummy brought me for dysmenorrhea, but doctor, I'm fine. This is well says well when he is sick. This is a rubric which is seen in Arnica. So what I'm trying to explain here is we as students have been, I mean, we read and we go ahead, and finally when you're sitting in the clinic, then you will start and think, oh, let me see. What I'm trying to tell is read the remedy and try to see how the remedy is different, how the remedy is can be individualized. And how can you do this? You can do this when you read the mind section of the repertory. And when you read the mind section of the repertory, try to understand everything. What is the basic disposition? What is the ailments from? What is the soric presentation of the rubrics in the mind section? What is the syphilitic state of the remedy? So when you read one remedy, if you understand one remedy from all these aspects, especially the mind, I am again and again talking about mind, because what happens is we all are very good with physical prescriptions. When the patient is sitting, we can ask 10 questions or 20 questions, or the patient himself can say a lot about the ameliorations or the the modalities or the location sensation. We all are experts in this. We all get this. Patient also these days knows my homeopath is going to ask me this, so let me tell all these things. So this is a good part. But if you look into the repertoire totality, you may miss out the mental PQRS. You may miss out the mental physicals and the mental particulars and the mental generals. And you may be left only with the physicals. So if your prescription may be right, your prescription may help the patient, but you may miss to hit the simillimum. Okay, so when you say I want to apply the law of similia, when you say that I want to use a law of simplex, when you say I want to give single remedy, so that single remedy should have both mind and the body. So when you want the mind, you should have what is the individualistic qualities of the mind. So if you want to know that, you should, when you're studying as a student, when you're reading a remedy, you should have the individualistic quality of every remedy imprinted in your mind. So if this is imprinted in your mind, then definitely tomorrow when you're sitting in your clinic, oh, that is Nux vomica. She's telling that when I am in dysmenorrhea, I just want to sit alone in my room. I don't want anybody to complain. So this is Nux vomica who's speaking, disturbed aversion to, quiet desires to be, rest desires to be. This you will remember when your patient is telling only when you read the remedy in that particular way. So all that I want to tell the students here is you have only 3 P's to help you. First is your professor, whatever your teacher is teaching you clinically or theoretically, go in depth about that. Go detail, ask more questions in detail, so that your teacher, because see, we all have textbooks. Today we have Wikipedia, artificial intelligence. You have resources to learn, but nobody can teach you like your own professor. So good universities like this, who's working so much for the benefit of the students, you should catch hold of your professors. Go back, read your books, come back to your professor and ask more from your professor. Second are the patients. If your professor is saying I gave Ruta to that patient, the patient is better, you have to catch hold of that patient also, to understand what was the individualistic qualities of those patients. How was this patient Ruta? Okay, so patients are the other best way of learning your materia medica. And third are the pioneers. Of course, the pioneers can be anybody who's sharing knowledge. It can be any of the textbooks, it can be any of the webinars or seminars that you're attending. So all that I want to tell the students present here today is use these 3 P's in your life and be happy for the fact that you are a homeopath. Okay, because what is happening is, I just explained, enjoy reading and enjoy reading the mind section. So what we have to understand is, you as a homeopath is the blessed one. You as a homeopath is the chosen one. Why? Because you as a homeopath has got the knowledge to heal. How do you heal? Because you know what this plant has got the powers. What is the healing abilities of this fish? What is the healing ability of this flower? So when you know this, when you have the knowledge about the healing abilities of all the things present in this world, you have the power to use this knowledge to heal the patient who is knocking your clinic. Okay, so be happy for you are a homeopath. Be proud of the fact that you are a homeopath, and enjoy reading books and enjoy reading the mind section, so that you become more efficient homeopath in your own clinic. So, with that, I thank you very much. I thank all the students for listening to me. I thank the faculty for giving me this opportunity, and thank you very much. I hope I was fair enough with the timings, although I went very fast.
Thank you, ma'am. Thank you for such a wonderful presentation for our students. These students have really benefited from your presentation, and you are also a source of inspiration for all these students who are sitting in the seminar hall and listening to you. And thank you very much for sparing your time. Now we have the time for some of the presentations from our BHMS internees. We would love that if you can stay here for some more time and listen to them and motivate those internees. Yes, sir.
Thank you, ma'am.
Thank you.
What topic you have decided for the Women's University? It was a very miracle and
Thank you.
marvelous, knowledgeable. Though our students and faculty member will understand, go through the your topics. Thank you so much. Thank
Thank
you.
you. Thank you.
Sir, can we start with the presentation of BHMS internees?
What will be the time?
Sir, we can at least cover 1 to 2 presentation pre-lunch.
Okay, start.
So now I would request BHMS internee Manvi Singh to come and present her presentation. Manvi Singh, BHMS internee.
Namaste, respected CEO and advisor sir, respected registrar ma'am, and present to all high dignitaries. I, Jaipur Manvi Singh, BSMS 2017 batch. So my topic is होम्योपैथिक मैनेजमेंट और अस्थमा। अब जैसे अस्थमा को जानते ही ये बहुत कॉमन हो गया है आजकल के, जैसे हर इंसान उठता बैठता आजकल का एनवायरनमेंट हो गया डस्ट की वजह से, किसी किसी को जेनेटिक की वजह से होता है, तो ये बहुत कॉमन हो गया। हर दूसरे तीसरे घर में कोई ना कोई एक पेशेंट मिल ही जाता है जिसकी वजह से।
Manvi,
जी सर।
please show your presentation, PPT.
Sir, is it not visible? The
Not
presentation?
visible.
Just a second, sir.
Yeah.
I request the technical team to approve the presentation because is it visible now, sir?
Yeah.
Okay.
ओके, सो लेट्स स्टार्ट सर। सर जैसे अभी मैंने बोला अभी कि हर दूसरे तीसरे घर में कोई ना कोई पेशेंट पाया जाता है अस्थमा की वजह से। अब उसको कोई भी दिक्कत हो सकता है, किसी को डस्ट की प्रॉब्लम की वजह से होता है, कोई जेनेटिकल होता है, किसी को परफ्यूम, स्ट्रेस, कोई भी कारण हो सकता है। और सर दिस सो asthma disease affected the airways that carry air of the lung to the lung. People suffer from this long lasting disease is called asthmatic. ये बहुत लंबे समय तक चलता रहता है, तब इसको इसलिए अस्थमा कहलाता है। In case of asthma, airways are swollen and inflamed. Due to inflammation, the airways become narrow, and due to this, there is a difficulty in the passage of air in the lungs. आपके ट्रिगर्स फैक्टर्स कैसे कौन कौन से होते हैं? एक वायरल रेस्पिरेटरी ट्रैक्ट इन्फेक्शन है, एक्सरसाइज की वजह, जीआरडी है, क्रोनिक सिनुसाइटिस है, एनवायरमेंटल एजेंट्स, यूज ऑफ एस्पिरिन, बेटा ब्लॉकर, टोबैको स्मोक, इंसेक्ट है, प्लांट्स हैं, केमिकल फ्यूम्स है, ओबेसिटी हो गया, इमोशनल फैक्टर और स्ट्रेस की वजह से भी होता है। अब रिस्क फैक्टर कौन कौन से? दो तरह के होते हैं, इंडोजीनस फैक्टर और इन्वायरमेंटल फैक्टर। इंडोजीनस में जैसे जेनेटिकल हो गया, एयरवे, जेंडर, ओबेसिटीज, कैसे भी। और इन्वायरमेंटल फैक्टर जैसे एलर्जेंस हो गया, रेस्पिरेटरी इन्फेक्शंस, कुछ भी। साइन एंड सिम्टम्स क्या है अस्थमा का? से वीजिंग हो गया, कफ पाया जाता है, चेस्ट टाइटनेस हो गया, डिजनिया पाया जाता है, वर्ड्स लेट नाइट एंड अर्ली मॉर्निंग, रेस्टलेसनेस है, प्रोक्सिमल कफ, डिकोबिटस पोजीशन, सिटिंग स्टॉप फॉरवर्ड, कॉल एक्सट्रीमिटीज पाया होता है इसमें, एसेसरी रेस्पिरेटरी मस्कुलर एक्टिव हो गया, वोकल फर्मिटेस इंक्रीज, बायलेटरल हाइपर रिजोनेंस साउंड प्रेजेंट भी पाया जाता है, ब्रोंकाई साउंड भी प्रेजेंट होता है उसमें। इन्वेस्टिगेशन के लिए हम एलएफटी करा सकते हैं, स्पायरोमेट्री हो गया, एक्सरसाइज टेस्ट कराते हैं, उसको एक्सरसाइज कराते हैं, उसके बाद देखते हैं कैसे थकान, उसकी सांस कितनी फूल रही है, ये वो उसके उसमें टेस्ट करा देते हैं। चेस्ट एक्सरे करा की वजह से हम लोग पता कर सकते हैं। सीटी स्कैन हो गया, ब्लड टेस्ट कर सकते हैं। जनरल मैनेजमेंट जैसे ह्यूमिडिफाइड ऑक्सीजन इनहेलेशन हो गया, स्टीम इनहेलेशन हो गया, वेंटिलेटर सपोर्ट, फिजिकल एंड मेंटल रेस्ट हो गया। और होम्योपैथिक मैनेजमेंट में वैसे तो अस्थमा की बहुत सारी मेडिसिन है, हम लोग कॉन्स्टिट्यूशनल मेंटली और बहुत सिम्टम्स की बेस पे कई मेडिसिन दे सकते हैं। बट मोस्टली जैसे आर्सेनिक एल्बम हो गई, उस पर अनेबल टू लाई डाउन, फियर सफोकेशन हो गया या एयर पासिस पाया जाता है। अस्थमा बस मिड नाइट में होता है। वेजिंग इन रेस्पिरेशन पाया जाता है। स्पॉन्जियोटोसा मेडिसिन है, उसमें ग्रेट ड्राइनेस है एयर पासिंग में। लेयरिंग्स ड्राई बर्न्स कॉन्स्ट्रिक्टेड रेस्पिरेटरी शॉर्ट पैथी पेंटिंग होते। डिफिकल्टीज है फीलिंग ऑफ द प्लग ऑफ इन लेयरिंग्स। ब्लैटर और टेलिस जैसे द रेमेडी ऑफ अस्थमा की है, स्पेशली वन एसोसिएटेड विद ब्रोंकाइटिस इंडिकेटेड आफ्टर आर्सेनिक व्हेन इट इज इनसफिशिएंट। एंटीमटार्ड मेडिसिन रैपिड होती है, शॉर्ट डिफिकल्टी ब्रीथिंग पाई जाती है, सीमएस वुड सफोकेटेड मस्ट सिट अप। नेटम सल्फ ये अस्थमा चिल्ड्रन में पाया जाता है, तो नेटम सल्फ अच्छी मेडिसिन है। जैसे डिजिया ड्यूरिंग डैम वेदर है, कॉन्स्टेंट डिजायर टू टेक डीप लॉन्ग ब्रीथ, ये सब मेडिसिन। बाकी होम्योपैथिक तो सिम्टम वाइज और कॉन्स्टिट्यूशन मेंटल के बेस पे तो कई मेडिसिन है। थैंक यू सो मच सर। एनी क्वेश्चन सर?
आपने
जी सर।
मानवी आपने लिखा है कि एक्सरसाइज टेस्ट कराएंगे,
जी
तो
सर।
एक्सरसाइज टेस्ट कौन सा होगा?
सर एक्सरसाइज टेस्ट जैसे कि तो कोई भी एक्सरसाइज करा के या थोड़ा बहुत फिजिकल वर्क कराने के बाद उसके बाद देखेंगे उसकी लंग्स
नो नो
कितना
नो नो
प्रॉपर
नो
वर्क कर रहे हैं, या
नो
फिर
नो
इसमें एक्सपायरोमीटर सर के बेस पे फिर देखेंगे प्रॉपर।
स्पायरोमेट्री से क्या करोगे आप?
सर एक्सपायरोमेट्री
Without
इंस्ट्रूमेंट
certified.
होता है, उसमें सर पेशेंट को बोलेंगे कि इसको फूक मारे और वैसे वर्क होता है।
No, 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 no. And what is about the blood test?
हाँ
What
ब्लड
kind of
टेस्ट
blood test? Yeah,
सर जैसे सीबीसी करा लेंगे ताकि कोई अगर
क्या कराएंगे?
एएसआर
और
सर सर
सीबीसी नहीं कराओगी आप? इओसिनोफिलिया बढ़ाया कि नहीं बढ़ाया देखोगे कि नहीं?
सर देखेंगे।
Please go through the topic again, right? In future, it should
जी
not
सर।
be not mislead the topic. Thank you.
Thank you, JDN Manvi Singh, for a very good presentation. Now we have another BHMS internee, Nimisha Singh. She will be presenting PPT. So I would ask Nimisha to come and present her PPT.
Namaste to respected C1 advisor sir, respected registrar ma'am, and to all the higher dignitaries present over here. I, JVN Nimisha Singh, BHMS 2017 batch, to present my conference on the topic An Approach of Homeopathic Medicine in Guttate Psoriasis with a Case Study. Sir, is it visible?
Not visible. Your PPT is not visible.
I would request technical team to please share this PPT. Please allow sharing of this PPT. Is it visible, sir? Is the PPT visible, sir?
Not visible.
Sir, is it visible, sir?
Yeah, start.
Guttate psoriasis is mostly seen in children and young adults. Guttate psoriasis shows for less than 30% of all cases of psoriasis. Lesions occur with an appearance like small droplets and less frequently as psoriatic squamous papules, generally manifesting after streptococcal infections. Guttate psoriasis is associated with HLA-CW6 gene. The case is a 31-year-old married male having whitish complexion belonging from middle socio-economic status reported an OPD dated 5th January 2021 with complaint of red patches with itching all over the body, especially on trunk and proximal part of extremities. Itching gets worse after scratching and increases gradually after slightest touch. Firstly, the lesion appeared on trunk in form of reddish blackish spots with itching. The lesions later spread from trunk to all over the body. The scaling of skin was also present. The clinical findings were guttate psoriasis on trunk and all over the body since 8 to 9 days. Scaling of skin with itching and burning was also present. The height of the patient was 5'8", weight 66.7 kg, pulse 72 beats per minute, blood pressure 130 by 80 mmHg. The past and family history was not so particular found. Physical generals, patient desired salty and spicy things. His appetite and thirst was decreased and thermal reaction was hot. Sleep was sound, stool was constipated and appeared as hard, dirty, dry, as if burnt and difficult to come out. His perspiration was offensive. The patient was very irritable and highly angered, especially when something is not done according to him. The patient was extrovert as he clearly stated all his symptoms without any hesitation. On the basis of red patches all over the body, especially on trunk with itching and burning along with scaling and offensive perspiration and hot thermals, the medicine was prescribed sulfur 1 stat dose and the advice was given to apply coconut oil on the eruptions and wearing soft and cotton clothes. This was the follow-up. The conclusion is homeopathic is an artistic symptom of medicine which treats the patient of the disease as a whole, not just the disease. In this case, patient improved symptomatically slowly after single dose of sulfur 1. This case showed effective role of homeopathy in treating guttate psoriasis. Patient showed improvement in beginning which proved correct selection of similimum medicine. Thank you. Any questions, sir?
Ah, you have discussed about the psoriasis,
Yes, sir.
but you have not tell about the sorinum. Which miasm is there?
What, sir?
Miasm. Which miasm is there?
Sir, Sora.
Sora. Then king of the medicine is the Sora. Who? No, you have not mentioned only. You have mentioned only sulfur. Why
No,
not
sir.
sorinum starts?
Sorry, sir.
Sorry, sir.
Thank you.
I have mentioned, sir, in the follow-up, I have mentioned the Sorinum medicine.
Where? ठीक है, okay.
Sir, shall we announce the lunch break or shall we continue with the presentation? Okay, sir. So now we are halting this presentation, this conference for the lunch break, and I request all the faculty members and students to go for lunch, and we will be rejoining the conference at 1 p.m. because we have the time slot scheduled for our eminent speakers and guests at 1 p.m. So we do not want to be late for that particular session. Now I would request all of you to kindly go for lunch and be here at 1 p.m. sharp so that we can start with the second half of this second day of conference. The remaining papers of the BHMS students, internees, and faculty members will also be covered in the second half. So please be prepared for your presentations. And with this note, I am concluding this first half of this day 2 of our international conference. Thank you very much. I especially thank our guests, eminent guest speakers who have joined today, Dr. Padampriya Nair ma'am and Dr. Praveen Suvarna sir. Thank you, sir, for being here with us. in this particular conference. I also thank our president in charge, sir, to be here with us in this particular conference. So with this, thank you very much. We will be meeting in the second half of this conference at 1 p.m. So thank you now. And we conclude this first half of the session. Thank you very much. Namaste, ma'am. Welcome back after the lunch session. Shortly, our dean sir will be joining, and then we will be officially commencing the post lunch session. Namaste, sir. Dr. Padampriya Nan ma'am is here. And please officially announce the starting of the second session of this conference.
Namaste, sir. Now, second session post lunch started. Open. डॉक्टर जयेश पटेल शायद ज्वाइन करने वाले हैं.
our new guests are going to join shortly. Then after we will be starting with the second session of this day two of our international conference on the topic of advancement in homeopathic research, including clinical trials, laboratory research, and case studies. As we have heard today from today also, just a minute. So some of our guests are getting delayed, but before proceeding further with this conference, we had one part that was left in the morning about Jyoti Vidyapith Women's University and about briefing about this conference. So till the time our eminent guest joins, let me share something about this conference with you all. A unique title has been suggested for this conference, which includes advancement in the homeopathic research, including clinical trials, lab research, and case studies. Yesterday and today, you must have seen all these speakers who were related to this particular theme itself. We had discussed various cases which are related to clinical trials. Yesterday, Dr. Anil Khurana sir told us very good about clinical research, the method of clinical research. Dr. Khurana is the chairperson of National Commission of Homeopathy who joined yesterday, and he told a lot of things about research, clinical research to the students. Very small, minute details about research was told by Dr. Anil Khurana sir. Then we also had Dr. Jayesh V. Singhvi sir yesterday from Chennai, and he told us about a lot of cases, his experiences, clinical experiences, especially experiences with a single dose. Today in the morning, we have seen that Dr. Vijay H. Vaishnav sir told a lot about the cases, incurable cases, very difficult cases of his early practice, which gave a lot of confidence to the students of BHMS and to the faculty members. Then Dr. S. Praveen sir told a lot about clinical research. He told a lot about the AIDS virus and also the various research studies, the clinical research studies, especially the lab studies that have taken place and that showed the efficacy of homeopathic medicine. Then Dr. Padampriya Nair ma'am also told a lot about the homeopathic medicine for the insight of the BHMS students. Today we also had one of our guests, Dr. Shobna Shukla ma'am, who was the professor of Government Homeopathy Medical College Bhopal, who also told a lot about the homeopathic philosophy. In the last session yesterday, we had various eminent guests from different parts of the world. Yesterday we had Dr. SPS Bakshi sir, who is also the chair professor at of the chair of Faculty of Homeopathy Science at Jyoti Vidyapith Women's University. Then we were also joined by Dr. Aisha Ali ma'am, who is the registrar MP Council of Homeopathy in Madhya Pradesh. We also had Dr. Pankaj Sharma sir, and who is associated with this university since a very long time, and he is like a mentor to us, who is always guiding us in each and every part of homeopathic practice, and also to the students. Yesterday, we also had very good presentations by our BHMS students and BHMS internees. Now, we also have some of the presentations remaining from the BHMS internees, faculty members, and some guests from the outside that we are going to start shortly. Research has always been a keystone in the students. It has been incorporated among the students of this particular university. Our founder and advisor, Sir Honorable Pankaj Garg, sir, laid a lot of emphasis in the research and development of the students and the faculty members. He paid a lot of stress on the research methodologies. He paid a lot of stress on the research practices that has been incorporated in the students. So research is the keystone. The students here are told about research from the first year of their admission, and then they are writing papers and also giving the publications. The students are giving copyrights. They are giving articles in various journals, both UGC and Scopus Care journals. They are giving various copyrights and publications. They are also writing book chapters and other important research activities. We also have a startup cell that is the key background for doing different type of research activities. So I'll not be taking much of your time, and now I will be starting with the presentations of the BHMS students, internees, and the faculty members. So as it will take some time for our guests to rejoin this conference, now I'm starting with the PPT presentations of our BHMS internees. I also request the faculty members to kindly come here for their presentation so that the presentation can go smoothly. Shortly, we will be having the presentation of faculty members and the guests outside. So let's start with the presentation of BHMS internees.
Yes.
Namaste, Namaste, respected CEO sir and advisor sir, dean sir, and all the present higher dignitaries. I, Javian Kinjal, from VHMS 2017 batch, present on case study on the efficacy of
PPT.
homeopathic medicine in case of tinea.
PPT, please, PPT.
PPT नहीं दिख रही सर?
PPT नहीं है,
Just a
विजिबल
moment.
नहीं है.
एक मिनट. Shweta, is it visible, sir?
Sir, is it visible?
Yeah.
Presenting a case study on the efficacy of homeopathic medicine in case of tinea cruris. Introduction. Tinea cruris is dermatophytosis commonly caused by trichophyton or T. mentagrophytes. The main risk factors are associated with a humid environment. Example like warm weather, wet weather, shrinking clothing, obesity, which causes constant accumulation of the skin folds. Males are more commonly affected than females due to the juxtaposition of the scrotum and thighs. Typically, itchy, ring-shaped lesions extend from the folds of the lower extremities to the adjacent inner thighs. Infection can be bilateral. Lesions can be complicated by maculation, malaria, secondary bacterial or candidate infection, and response to treatment. In addition, scratch dermatitis and lichenification can occur. Case study. Here I am presenting the patient's presenting complaint with a patient came from Surat to consult homeopathic physician on 15 July 2022 with a eruption on pelvic, pubic and breast folds and hands. She also told that she is suffering from this eruption since 2 weeks. She had multiple eruption in folds and pelvic region and around umbilicus. She told it was her first time to suffer something like this and she is very worried of her condition. Sometimes her skin was so dry and there was a lots of itching and burning. She applied coconut oil, but there was no relief and her eruption gets large and worse and made her more worried. Considering all complaints, physicians started treatment process. After the case study, first prescription 15 July 2022, Pulsatilla 200 OD given, but the symptoms not relieved. Then 18 July 2022, sulfur 200 OD, but there was no improvement in patient symptoms. After the case study, 24 July 2022, lectin 200 OD, repeated every 6th day of week and relieved in symptoms. This is the picture before prescription and after prescription. And now the patient has no complaint. Result and discussion. Many cases of tinea cruris till today are being successfully cured by homeopathy. Homeopathy provides a very good scope for these cases with a plus point of no recurrence of the condition. With proper case taking and understanding and proper selection of medicine at right time, this kind of cases can be well handled by homeopaths. Conclusion. A case of tinea cruris with several other symptoms was well managed by homeopathic medicine in about last 6 month duration. Thank you.
Pinjal,
Yes, sir.
you please tell me कि 15th
Yes,
of
sir.
July you have given a single remedy. Pardon? And again on 18th you have changed the medicine. Why? We must give the time to the medicine as a remedy.
Yes, sir. But the patient is
First
with
prescription
a
should
disease.
not be changed as so early, right?
Yes, sir.
Thank you.
Thank you, sir.
Thank you, Kinjal, for a very good presentation. Now we have another BHMS internee, Brinda, for her presentation. BHMS internee, Brinda Rana.
Namaste and good afternoon to all the higher dignitaries present here. My name is Brinda Rana, BHMS intern 2017 batch. Today I will be presenting on the topic nephrolithiasis.
Is it visible?
Is it visible? Is the PPT visible? I repeat, is the PPT visible?
Yes.
Okay, thank you, sir. So the topic is nephrolithiasis. Firstly, we'll start with the introduction. So nephrolithiasis or renal calculus is one of the most prevalent diseases in India. It presents with several life-disturbing symptoms. Nephrolithiasis refer to hard deposits of minerals and salts forming due to supersaturated urine in kidney. It is one of the most common topic or most common disease for which homeopathy is known, especially in India among the common peoples. Pathophysiology, it's very simple. Urine is composed of water and certain particles such as minerals and salts, from which if any substance becomes too concentrated, the solution becomes supersaturated, which results in the precipitation of the same particles. These particles forms crystals which are called nidus, which works as base for some solutes, for more solutes to deposit on it. Over a time, it builds a crystalline structure that we know as renal calculi. Causes, there can be several causes from which some are here. Recurrent UTI, dietary factors such as high calcium in protein diet, hyperparathyroidism, which leads to imbalance in calcium metabolism, paraplegic patients. In these type of patients, the bone gets start to dissolve in the blood, leading to high calcium levels. Next is inadequate drainage due to obstruction of urinary pathway. Sign and symptoms,
This is not necessary that as soon as the calculus is developed, the symptoms will show, but over a time, symptoms will appear. The symptoms may be dull, aching to pricking type of pain, usually in lumbar region, nausea and vomiting due to sympathetic stimulation due to stretching of renal capsule, ureteric colic if the calculus gets impacted in either pelvic junction or ureter or bladder, then this can happen. Hematuria usually happens in some type of calculi like calcium oxalate calculus because they have spikes in them. Next is recurrent UTI. Recurrent UTI is a cause as well as a symptom of nephrolithiasis. Next is gardening and rigidity of back and abdominal muscles in severe attacks of pain. Investigations will go for X-ray USG. IVP means intravenous pileogram, in which X-ray dye is injected intravenously in the patient, and then X-ray pictures are taken, blood creatinine level, and blood urea level. Miasmatic approach. In order to gain rapid, gentle, and permanent cure, considering the miasm during selection of remedy is extremely important. Nephrolithiasis prominently calls for psychosis, although it can present as either psora psychosis or psychosyphilitic according to patient's symptom. As miasmatic diagnosis is done on the basis of patient's physical as well as mental generals, so every patient's miasmatic diagnosis will also differ. Now here is a case presentation in short. A patient named Jitesh Tiwari, aged 25 years, came with pain in left renal region with numbness extending to left testicle and hip from some days. A feeling of nausea was constantly present. After investigation, USG was done. It was found that he had left ureteric calculus of 14 mm. Modalities were aggravation when stomach is distended and amelioration from complete rest. Physical generals were thirst and appetite was normal, but patient had tobacco desire with weakness and headache following smoking. Mental symptoms were disappointment of love. He was suffering from depression, fastidious, cleanliness want, mental torture behind a cheerful face. This was a person's personality. Mind was weak to take any stress, and all day the person talks about death. The results were patient suffering from renal colic due to renal calculi of 14 mm in his left ureter was relieved from this colic after homeopathic treatment for about 6 months with appropriate medicine for his condition such as Nux vomica 30, which was given in first prescription, then waited for 45 days, then it was repeated in duration of 30 days of 3 times. Next medicine, hydrangea albicans, is the mother tincture. It was given throughout the case. Berberis vulgaris, starting 1 month it was given. The case first prescription was given on 16/6/22, and after about 6 month duration on 24th December 2022, calculi came out during micturition with a little discomfort, but after that patient was completely relieved. So homeopathy provides a very good scope for these type of cases with a plus point of no recurrence of the condition. With proper case taking, understanding, and proper selection of medicine at right time, these type of cases can be well handled by homeopaths. Thank you. Any questions, sir?
Thank you.
Thank you, Vrinda, for a very good presentation. Now we have another presentation from BHMS internee Yetvi.
Namaste to requested advisor and CEO sir, Registrar ma'am, chief guest, dean and directors. I, JVN Hitvi Maravya, present over here with my today's topic, role of homeopathy in case of postpartum depression. Is it visible, sir, PPT? Presentation? Sir, presentation.
Not now.
Is it visible,
PPT
sir?
not presenting.
Is it visible now? Is it visible, sir? the PPT?
No, not yet.
Is it visible, sir? Now?
PPT. Now you start.
Okay, sir. So today's my topic is homeopathic role in case of postpartum depression. Postpartum depression has been identified as the most common complication of childbearing. It is estimated that between 10 to 20% of all childbearing women will be affected by postpartum depression. This disorder not only affects the well-being of the mother but of the infant as well. Barriers to care that have been identified include stigma, lack of childcare, finance, poor past experience with healthcare providers, language barriers, failure to recognize own symptoms as PPD, and providers' lack of understanding of the condition. Postpartum depression screening. So basically, three scales are here. With the help of this, we can identify postpartum depression. First is Edinburgh postnatal depression scale. Second, postpartum depression screening scale, and back depression inventory 2. Treatment for postpartum depression include both pharmacological method and non-pharmacological method. In pharmacological approach include use of antidepressant medication, and in non-pharmacological method we suggest patient to take cognitive behavior therapy, personal behavior therapy, musical therapy, and etc. There are some homeopathic medicines which we can use to treat symptoms of postpartum depression, like pulsatilla, natromure, ignitia, ambragresia, and sepia officinalis. Summary. A report from the WHO found that self-inflicted injury was the second leading cause of maternal mortality, and the disorder not only affect the health of mother but of the infants as well. Studies have found that infants of mother with postpartum depression have diminished maternal infant interaction, delay cognitive development, and issue with attachment. Although there are screening tools available that are widely used at routine postpartum office visits, and half of all cases still under condition used and untreated. Thank you, sir. Any queries?
Thank you, A3, for a very good presentation. Now we have another internee, Devina Vachaspati, who will be presenting a presentation. Devina Vachaspati, BHMS internee.
Oh, wait. Hello. Namaste, sir.
Ravi.
Very good afternoon to each and everyone. I Devina Vachaspati, BHMS internee here present. I Devina Vachaspati here present my paper on this
Ravi.
time.
Devina, please listen. Ravi,
Yes, sir.
Dr. Jayesh Patel and Dr. Pankaj Sharma has joined.
Has joined, sir. We will continue this presentation later on, sir.
Namaste, Dr. Saab.
Ajay, namaste, sir.
Namaste, namaste.
Yes, I'm ready.
नमस्कार.
Yes.
Namaste, sir.
Glad to
आपका स्वागत है सर.
जी सर.
ये सेकेंड डे का पोस्ट लंच कॉन्फ्रेंस है, इंटरनेशनल वर्चुअल कॉन्फ्रेंस.
Yes, sir.
So please you give your
Presentation.
subject matter presentation.
Okay, sir. Is it the right time for me? Because
Yes,
as per the schedule, it is
Okay,
2
okay.
p.m.
No, you can start right now.
Okay, sir. Thank you. Thank you. So, good afternoon to every respected doctors and namaskar every respected doctors from the Jyoti Vidyapith Women's University, Jaipur. And here is myself, Dr. Jayesh and Patel from Surat, Diamond City and Textile City of Surat, Gujarat State. Here is my brief introduction. I have been doing consulting homeopathic practice for 36 years. I'm very in my homeopathic practice. I have done MD homeopathy from Aurangabad Baba Saheb Ambedkar University in 2007, MDPN, that means Memory Development and Psychoneurobics, in 2011 from the Tamil Nadu Sports University. Third degree that I achieved from Hanuman College of Homeopathy, PG Home London in 2014 with a base thesis award. Fourth degree that I achieved from same college, Fellowship of Hanuman College of Homeopathy, UK 2015 with a gold medal. And last both degree that I achieved from the Master Hanuman College of Homeopathy, London. Here, the principal of it, Dr. Sasimon Sharma, sir, is present, and special thanks and namaskar to Sharma sir. Here,
Namaste, sir.
much.
Sorry
Yes,
for
sir.
that. Dr. Pankaj Sharma, sir, I welcome you today.
Yes, sir. Thank you.
Yeah.
Namaskar. Am I audible?
Start, Patel, sir.
Yes, sir. Previously, what I gave that information that is audible, that was audible.
Yes, sir. You are audible, sir. Please continue.
Okay. Now, here I am also much thankful to organizers of this conference, and they are from the Jyoti Vidyapith Women's University. And special thanks goes to Dean of this college university, Dr. M.P. Sharma sir, and faculty of it. My special thanks also goes to Dr. Nikunj Trivedi. Dr. Nikunj Trivedi gave me a message on the last night, and in beginning I was very much reluctant for this conference because within a overnight, how can I prepare myself for this conference? But lastly, I gave consent at 2 a.m. And in the morning, with the help of my son, Dr. Patik, PhD scholar, we could manage to present my view amongst all of you. After this brief introduction and brief background, I would like to show my view on pigmentary disorders of the skin and its homeopathic treatment. It is very vast. I know this is very vast topic and it requires a lot more time to understand it. But here I would like to show you some brief matter of it. So over to that screen. One minute.
Sir, your PPT presentation is not
Yes,
showing.
yes, we are making it ready. Just wait few seconds. Yes, it's ready. So welcome you all. Here is on the screen the title, Pigmentary Disorders of the Skin and its Homeopathic Treatment. I already gave my brief introduction. Namaskar to Guruji. Respected delegates. Sorry, this is for the international seminar and I prepared it
Sir, it
from
is
the...
visible.
Yes. The pigmentary disorders, PD of the skin, PDS. That means there are many kind of the color related problem that arise on the body and especially on the face or the other parts of the body. Now, as you know, that it is in this modern and the fashionable science, fashionable world, if any cosmetic problem arise on the skin or even tiny blemish, the blemish that means dots, appear on the face or other part of the body, they may become white. It, it may be white or the pale spot or the dark pigmented spot. Such kind of the pigmented spots make them worry. So today I shall try to show you all this in this conference. It makes them worry about it. It also forces them to run here and there, and ultimately they try to find advice from one dermatologist to another dermatologist, and also from one beautician to another beautician. No matter whether it is tiny blemish forms or the white pallor or dark brown or the bluish hue or anything else color related. It always gives distressing feeling to everyone. It can also make them disturbed by cosmetically, psychologically, or in their society or in their social adjustment. So, in this picturesque world or in this fastidious world, everyone is in the pursuit of having smooth, fair, snow white skin or in blemishless skin. Even in the search of their soulmate or bride or groom or model or an actress or an actor or secretary, etc. Here, every concerned person is in search of the beautiful or the handsome personality. So, dear delegates, my experience in the homeopathic practice more than since 1986. Today, it is more than 36 years. It says that in this regard, we have a lot of scope to cure such kind of the disorders. Here, I did MD from Baba Saheb Ambedkar University, Marathawad, Maharashtra. Now, I would try to, because time is so less, so I would avoid some slide. Here is the dermatological aspect of the skin that will, I would refer to the all the delegates that go through in a physiological and anatomical aspect. Here, I will avoid this whole thing. Here is a diagrammatic form of the melanocyte. You can see the like cells, like it shows like a tree. That trees like cells are our melanocytes, and it produce pigments, and ultimately, 1 minute. These trees like cells, it produces the melanosome, and ultimately we have a uniform color of brown coloration, and we have a normal hue on our skin. So if it becomes pathologically destruction take place over there, we have a white spot. Yeah, if there is a function, it become very less, then we have a paler spot, and if it produce lots more pigments, melanosome, then it becomes hyperpigmented spots. Now, here is the few more slides. That is mainly we have a three pigmentary main disorders, and in that depigmentary disorders, second category that is hypopigmentary disorders, and third one is hyperpigmentation or hyperpigmentary disorders. In number one, the absence of the melanin pigments, yeah, melanosome, and it will produce the vitiligo-like problem, yeah, contact leukoderma, yeah, albinism, etc. In second category, here the decreased number of the melanin pigments, and that means it will produce pityriasis alba, yeah, pityriasis versicolor, etc. In third category, here the increased number of the melanin pigments, and it and ultimately we have a chloasma, yeah, freckles, yeah, lentigo, etc. In detail, we'll see later on. 1 minute. Here is the melanocyte cells. You can see it shows like a trees, and it is dendritic cell. It is not rounded cell, it is dendritic. And in each dendritic specules, we have a production of the melanosome. And ultimately, we have a brown discoloration. Here is the microscopic view. Sorry. Here is the microscopic view of the melanocyte cells, and the greenish tone, that is our melanosome. And that melanosome, because of that melanosome, we have a brownish discoloration, brownish coloration. Sorry. Am I audible? Hello. Am I audible? Excellent. So here is another slide. It shows the melanocyte cells, and it is also known as the dendritic cells. And you can see the pigments, that is melanosome. Here is another slide. It shows the melanocytes. Here is the melanin pigments and melanocyte cell. Now, regarding somewhat depigmentary disorders, the term depigmentation, that means the pathological loss of the normal pigment, is known as a depigmentation of the skin. An example, that is like vitiligo. The vitiligo is also known as acromia, and there are following disease comprises in these depigmentary disorders. One is vitiligo, second one is contact leukoderma, third one is albinism. Here is the slide. You can see the vitiligo. Here is a totally loss of pigments, and we have a white skin. Here is somewhat more deep aspect of the vitiligo. The synonyms is leukoderma, skin pybole, या acromia.
सर
Is
सॉरी टू इंटरप्ट यू सर.
yes sir.
सर आपकी पीपीटी आगे नहीं बढ़ रही है.
Okay.
शायद
How much
फर्स्ट.
time that you have allotted me?
नहीं सर, टाइम इज नॉट द कंस्ट्रेंट हियर. आप टाइम
Okay.
ले सकते हैं, लेकिन
Okay.
आपकी पीपीटी एक स्लाइड पे रुकी हुई है सर, आगे नहीं बढ़ रही. आपके
आगे
लिए
नहीं
तो
बढ़
बढ़
रही.
रही है जी.
हाँ 1 minute. हाँ, it's
तो
showing stop
इसलिए
sharing.
इंटरप्ट किया, सॉरी सर,
हाँ
लेकिन
no problem, no
आगे नहीं.
problem. Sorry, somewhat some technical problem is over here.
If you
Now,
need, you can share the PPT with me. I will play the PPT, sir.
okay,
It is not
okay,
an issue.
okay, 1 minute. આપણે એમને મોકલાવું. હા, એટલે ત્યાંથી શેર કરો. હા. 1 minute, sir.
You have to share entire screen, sir. Not
Okay, okay.
just slide. Entire screen.
My son will do the whole matter. 1 minute.
Okay, sir. No problem, sir. Sir, you have to share the entire screen, sir.
Okay, okay. WhatsApp करता हूँ एक मिनट.
हेलो.
हाँ 1 minute.
मेल करवाइए.
I'm sending you the whole
Sir,
PPT.
please mail the PPT if possible
Yes.
on Dean sir email ID. Then I will
Sending
play
you.
it from here only, sir.
Okay.
There will be no issues. Just mail the PPT on JVM DR
Okay.
IP Sharma.
Dr. MP Sharma,
Yeah.
I sent on them. The Vitiligo London. Have you got it? MP शर्मा के सर के ऊपर मैंने भेज दिया.
Sir, आप please forward कर दीजिए and I will play it from here, sir.
Okay.
Please forward it to me and I will play it from here. There will be no issues.
I will
sir.
send to the Sharma sir.
जी sir.
Share screen. Now is it visible?
No sir, not visible
Wait,
yet.
sir, wait.
हाँ. Not yet. I have sent the whole PPT to Dr. MP Sharma sir.
Sir, now it is visible, sir. You can play the PPT, sir. It is
Okay.
visible from your side also, sir.
Should I start from very beginning?
Yes.
Yeah, just for a...
No, sir, you can continue from here also, sir.
Okay. So here in vitiligo, here we will see some more about the vitiligo. The synonyms of these: leukoderma, skin pybole, या acromia. And this is a common skin disorders in which there is a focal failure of the pigments due to the destruction of the melanocyte cells. Here destruction takes place and ultimately we have a white spot. It is thought to be mediated by the immunological mechanism. Its synonyms is, as I told you before, leukoderma, or the name itself suggests that leuko, that means white, and derma, that means skin. And collectively, it is known as white skin, yeah, leukoderma. The other synonyms of it is a piebald skin, and that means skin having colors of the irregular patch, and typically they are brown, white, and due to localized loss of the melanocyte and destruction of the cell production. આ થારું પટ્ટી. બસ એ. So, due to localized loss of the melanocyte or the destruction of these cells, it produces patchy loss of the normal skin pigment. So, it becomes piebald skin, as like in a piebald horse. चता इन गुजराती या इन हिंदी चतापट्टा वाला हॉर्स जैसा स्किन हमारी दिखती है. हाँ. Yes. There is a focal failure, I already told you. Now, another variety that is also known as the contact leukoderma. The depigmentation on the contact area with articles containing the monobenzyl ether or the hydroquinone MBH, it's a chemical name, or other depigmenting chemical. And it is also produced by the rubber footwear, adhesive coated bindi, or that bindi dot worn on a mid of the forehead by the Indian woman, rubber gloves, and possibly some condom on glans penis. Definition: in some chemical it produces localized destruction. So we have a white spot. Uh, the the offending article is footwear, rubber gloves, condom, etc. Albinism. Albinism, that means Al albus, that means white, and it's a Latin word. And in Greece, German words, it is condition, white condition, and that white condition is genetically. The genetically or non-pathological or the partial or the total absence of the pigments in the skin or hair and eyes and in eyes. It is often accompanied by the astigmatism, photophobia, and nystagmus because the choroid is not sufficiently protected from the light. As a result of it, we have a lack of pigments. And definition of it in a brief: the genetic non-pathological disorders, and sometimes partial, it could be partial, it could be total absence of the pigments, and can be seen in skin, hair, or in eyes. Cure with the homeopathic medicine is a limitation. Second big variety, that is hypopigmentary disorders. The term hypopigmentation, that
Sir,
means the decrease.
excuse me, sir.
Yes, sir.
Sir, again the PPT has stopped. It is not moving, sir.
Not moving. Oh, sorry, sir.
Sir, the link that you sent was the shortcut actually.
Ha
So
ha
it
ha
is
ha.
not opening, sir.
It's showing.
Sir, can you please mail the PPT?
मेल
I
कर दो
will
वन
play it
मिनट. ओके.
issue.
व्हाट्सअप से नहीं आता है.
नहीं सर, व्हाट्सएप से आ नहीं पा रहा सर के पास
ओके
से, बट
ओके ओके ओके.
मेल आप कर पाए सर.
हाँ, मेल से
JBN
भेज.
MP शर्मा पे. I will play
यस
it from here, sir.
यस सर.
JBN MP Sharma, please mail the
हाँ हाँ
PPT on
यस.
this.
ईमेल, हाँ ईमेल से.
I have already sent to my mail to you, sir.
ओके
Sir,
सर.
it is not opening,
Just
sir.
we are making a try. 1 minute. Yes. This conference, is it for 1 day, 2 day, 3 day?
This conference is for 2 days, and this is the second day, sir.
Okay, this second day. Okay.
Yes, sir.
in this world, techno savvy is to become a techno savvy. It is very essential, but somehow we are not making a face with this technology. I have already done WhatsApp, but by
It is not
yeah,
coming, sir. The WhatsApp is not coming.
email.
Please mail the PPT, sir.
1 minute. हाँ, लगता ही जो attach करवाना थे attach file insert my drive computer share with ठीक दे दो ये
Meanwhile, I am
yes
requesting to Dr. Pankaj Sharma sir, please give your remark.
yes
No, no. First he complete his. After that, we will take call. How it is possible to give the remarks with such type of the CA person?
yeah.
Just wait and watch. He will
1 minute
come. Let him complete.
1 minute email थी आपका email ID JVNDR MP
Sir,
hmm
Dr. Shashimohan Sharma sir will join at around 2:30 p.m.
okay sir
sharp. And Dr. Padma Priya Nair
yes
with us since morning today.
yes हाँ શું થાય अच्छा upload लो sir is getting uploading in your email okay. Have you got it by email
Sir, I haven't received it yet. I'm waiting for
uh,
your mail.
yes
Yes, sir. I just received the mail.
yes okay
Just
now you
I'll
can
just download.
play it from you and I will share my view
Just a minute. Sir.
have you got it
This is a big. Okay, sir. I have downloaded it. Let me play the PPT for you now.
okay
Just a moment. This is actually a big file, just getting downloaded. It is around
हाँ
100 MB
yes
file.
yes it's
Just,
true
just I'm downloading this PPT. All right, sir. Now I'm sharing the screen with you.
Okay.
Just let me know when it is visible to you, sir.
Please send.
This is the presentation, sir. Just is it visible to you, sir? Just tell me on which slide I have to go. Is it visible, sir?
Yes, it is visible.
Okay, sir. Just tell me on which slide I need to go, sir. Should I go
Yes.
ahead? Dr. Jayesh, sir, can you listen to me? Sir, is this PPT visible to you, sir? Sir, your voice is not coming. Please reply to me, sir.
Yes, sir.
Yes, sir.
Your
Is it
voice
visible
is
to
not
you, sir?
clear, sir.
Is
Now it
this
is visible.
all right, sir?
Yeah.
Tell me on which slide I need to go, sir.
Just go beyond 4, 5
Should I
slide
go
beyond.
ahead?
Yes, 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 yes. One more slide. Huh. Yes. Now regarding the vitiligo, are you all okay?
Sir,
Yes, sir. Perfectly
sir,
fine,
this is
sir.
my request to you. Please
Yes.
conclude your topic up to 2:15 p.m. sharp.
2:15 p.m. Okay, sir.
Should I
So
move ahead, sir?
yes, yes. I will try to enumerate the few names of these because I don't want to go in much detail. Okay.
Okay, sir.
So here is the vitiligo. Now next, sir. Play from your side, making a next slide. It is second variety is that is contact leukoderma. That is also because of some chemical and it produces the depigmentary disorders. Next slide, sir. The offender is like rubber gloves, etc. Stop sharing. Stop sharing. Third variety is albinism, and here we have a limitation. Next slide, please. Second variety that is hypopigmentary disorders, and in hypopigmentation, it is somewhat very opposite to that, somewhat different than the depigmentary disorders. In depigmentary, there is absence, and in hypo, that means some less pigments are there, and we have a 5 variety. One is pityriasis alba, also known as the PA. Second variety, pityriasis versicolor, and third variety is that is chemical hypomelanosis. Fourth variety, halonevus, and fifth variety, leprosy. Next, please. Here is the some photographs of that tinea versicolor, pityriasis versicolor. Here is some uh, varieties, pityriasis alba, and that is you can see the in common words, it is also known as the vitamin deficiency disorders, and it looks like a hypopigmentary disorders. There is a fine adherence scaling also on it, and it is marked by the patch of the round or oval with irregular border of the macular lesion. Here is the macular. That means that related with the skin level. It is not the raised part. And this kind of lesion can be seen commonly amongst the children, and especially on the facial area of the children. And in later, it may turn into vitiligo. So, in such case, we have to be careful. Second variety that is pityriasis versicolor. In Gujarati, it is also known as karodia. And in here, you can see the yellow fawn color brand patches. Brand patchy, brani patchy, that means the small patch are there, small scales are there, and it is also known as the fungus infection of the skin. And uh, next, please. And here is the organism, fungus organism, that is Malassezia furfur. Next slide, please. The Malassezia furfur. It is often causative agent. Uh, Another variety, same. It is you can, yes, you can proceed one more. Now another third variety, that is chemical hypomelanosis, and it here is a chemical monobenzyl ether or hydroquinone. It is a causative factors. Next, please. The molted skin. Here is another fourth variety, and fourth variety, that is Saturn leucoderma. And in this Saturn leucoderma, there is it is also known as the neomelanocyte nevus. Nevus, that means from birth we have got such kind of the lesion, and it is also known as the Saturn's leucoderma. And here you can see the circular patch of the pigmented skin, melanocytes, and surrounding area it becomes whitish. It is now fifth variety, leprosy. It is also known as the Hansen disease, and it is chronic infectious disease of the skin and peripheral nerves. It is also caused by the Mycobacterium lepra. Next, please. This condition doesn't come in the pigmentary disorders, but for the purpose of the understanding, I have placed over here as a hypopigmentary disorders, because it is not related with the depigmentation. Yeah, only hyperpigmentation, and it is like a anesthetic patch. Third big variety, that is hyperpigmentation, opposite to every previous two one, depigmentary disorders and hypopigmentary disorders. See, this one is the opposite, and we have a 15 variety. One is backside, cloasma. Second, just back, freckles, lentigo, primary hemochromatosis, nevus, periorbital melanosis. Next, please. Addison's disease, acanthosis nigricans, post-inflammatory epidermal melanin hyperpigmentation, post-inflammatory dermal melanin hyperpigmentation, 11th idiopathic guttate form and confluent hypermelanosis, 12th fixed drug eruption, 13 drug-induced hyperpigmentation, 14 photocontact pigmentation, 15 pigmented. That means just move ahead. Uh, Sir, please try to remove that scroll. It is hiding the matters. Yes, just yes. 15 variety, that is pigmented purpuric dermatosis, and also known as the Scamber disease. So 15 variety, 13 variety in hyperpigmentation, 5 variety in hypopigmentation, and 3 variety in depigmentation. So totally we have a 23 color pigmentary disorders in the skin. Here is the hyperpigmentation that found on this way. It is like melasma or cloasma. The synonyms is melasma, marks of the pregnancy, and cloasma gravidum. The tan to brown sharply defined patch on the skin pigment, and usually found symmetrically on the forehead, temples, cheeks, or the upper lip. The excess of the pigments often occurs in a pregnant woman. Next, please. Next, please. Same. Next, please. Second, freckles, and also known as the aphilis. The freckles, that means we have a Bediaga medicine, but it doesn't give proper reason. Freckles, that means a small stain or the pigmented spot on a sun exposed area, and simply it is 1 minute. It is small brown stain and the pigmented macular lesion. Macular, that means raised than the level of the skin, and that occurs on the face very commonly in a white and blonde personalities. Next, please. Here is the lentigo. That means the flat brownish pigmented spot on the skin, and due to increased depositions of the melanin and increased number of the melanocytes, we have a such kind of the lesion. It is also known as the Hutchinson's freckle, solar lentigo, lentigo maligna melanoma. Next, please. Next, please. Ah, Another fourth variety, primary hemochromatosis, also known as the bronze diabetes. And this is a genetically disease and marked by the excessive absorption and the accumulations of the iron on the body. And here the iron is deposited in the viscera, including the pancreas, and giving rise to the diabetes. And that means it is termed as a bronze diabetes. I have never ever met with such kind of cases. Next, please. Synonyms. Say. Now, nevus. That means birthmark, yeah, mole. It is congenitally discolorations of the circumscribed area of the skin due to the overpigmentation. Nevus of the ito, yeah, nevus of the ota. These are the two uh, sub-varieties. Next, please. Here is the strawberry nevus. It is birthmark and it could be from the birth. The congenital discolorations of the circumscribed area of the skin due to the pigmentation. And another, the circumscribed vascular tumor on the skin and usually congenital and due to the hyperplasia of the blood vessels. I have been able to take result in following such kind of the cases with a Thuja. Periorbital hypermelanosis. It is common in a certain race and often familiar. Here, the dark brown hyperpigmentation occurs around the eyes. It is accentuated with a physical or mental fatigue, night watching, anemia, anemic condition, worm infestation. These kind of the causes are behind it, and these may remain stationary. Stationary means oh, it lasts very long. Next, please. Here is Edison's disease, and Thomas Edison, the common name of founder name of this Thomas Edison, British physician, 1793 to 1860, and he has made a research on this Edison disease. Here is acanthosis nigricans and hyperplasia of the germinative layer, and also it is also known as a stratum basale. And here the Malpighian cells are situated in this layer. Uh, Nigricans, that means blacken, and synonyms is keratosis nigricans. Here the skin become velvety and thicken. Rugosity of the skin. One minute. Sorry. There is a velvety thickening and increased rugosity of the skin of the various flexure like axilla, groin, back of the neck, etc. And the look of the lesion is with increased pigmentation of the skin. Here is the ninth variety, post-inflammatory epidermal malignant hyperpigmentation. It is very superficial, and it can be removed with the Ledampal, Arnica, etc. Another variety that is post-inflammatory dermal. This is very deeper aspect, situated in very deeper aspect, and it is very difficult to treat it, but it requires long-term therapy. So here you can see the deeper aspect. 11th variety, idiopathic guttate confluent hypermelanosis. It's a drop like confluent, and that means to run together. Confluent, that means run together. Toxic melanodermatitis. You can skip it. Here, fixed FDA, fixed drug eruption. After some medicines, sulfa-like medicine, yeah, whatever it may be, and it produces such kind of the lesion. It is also known as the fixed drug eruption. Simply, sulfur few doses is necessary over here. Drug-induced hyperpigmentation. There are many modern anti-hypertensive and anti-epileptic and anti-convulsion, anti-arrhythmic drug, etc. Such medicine can produce the hyperpigmentation, and it looks like this way. Uh, Another 14 variety, that is photocontact pigmentation, also known as the Burlesque dermatitis, and this was previously known as the Burlesque dermatitis. And here such patients develop hyperpigmentation on the skin, and it coming in a contact with a sun sensitive sensitizing agent followed by the exposure to the sun. Perfume, body spray in an armpit, it can produce such kind of the lesion. Carboanimal's are the medicine. Photocontact pigmentation, pigmented purpuric dermatosis, capillaritis या Scamber disease. And here Scamber disease, another 2-3 names are there. Lichen aureus is another name. Varieties, sub-varieties. Next please. I have been able to take a result with carboanimalist. Next please. You can skip this slide. Here is also you can skip it because it's a theoretical matter. Here I want to say, I want to convey the message. With an adequate and efficient therapeutics, they become powerful agencies for the benefiting humanity. This is a statement from the Stuart Close. That is, we should know the efficient therapeutics. We should have a knowledge of the therapeutics. Another matter from the H. Robert, if we do not increase our knowledge of the capabilities of our drug, our homeopathic art will become static. It रुक जाएगा. That means homeopathic science will make no progress. So at least we should have a knowledge of the therapeutics. Here some medicines, and that is related with the depigmentation, hypopigmentation, and hyperpigmentation. So I have made a tick mark with those who have a much more efficacy. I mark with the 3 tick mark, and those who have a less affinity, this efficacy, that I mark with 2 tick mark. So various medicines are there: sulfur, ars sulflavum. Many medicines are there. You can share in your group. Next, please. Diet regimen. It is also essential. You should avoid. Here is the method: the Hahnemann concept on the local melody, Stuart Close concept on individualizations and the posology. Another method, Alice Barker concept on healing, and Burnett concept on red matter organ testing therapy, Gibson Miller concept on the proving, and one Warninghausen method by the. This whole concept you can put in your practice and you can make a result. You can get the result. Next, please. There is another concept from the J.H. Clark, practical aspect, Garth Borick, that also related with the basic symptoms, William Borick, that need of the pathology. Yes. Cases of the pigmentary disorders. There are 16 cases, but we'll avoid it because time is very less. Next, please. If you want to share, I will give you the result. I will show you the result. Only after the Cantharis, you can see the result. Because abrasion was there and the friction was there, so I chose the Cantharis. And after Cantharis, in 30 days, you can see the result. Next, please. Another case, the vitiligo is a constitutional illness with history of the worms, and that I treated with the Sina 200, lastly with sulfur 200 as a intercurrent. Next, please. Here is the same case. You can see before, during, and after. Here is another case of the vitiligo after burns that I treated with the causticum 30 and later causticum 200. Still after 15 years, there is no any recurrence. Here is another case that I treated with acid nitric, few doses, 200. Here is another case and that I treated with sulfur 1M to sulfur Cl.
I think
Not audible, sir. Not audible.
Dr. Jayesh, sir, can you hear me? I think sir got disconnected. I couldn't get any reply, so I have to turn down this PPT because I was getting no response from sir's side.
Dr. Jayesh Patel said electricity has gone, so he is disconnected.
Okay, sir, no
Thank you
problem.
very much, Dr. Jayesh Patel, sir, for your good PPT
Sir, shall
presentation.
we continue with the presentations now?
Yes, you can start.
But before that, sir, can we have few words from our honorable guest, Dr. Pankaj Sharma, sir? He is here with us. So I would request him to say a few words today for the
Yes.
students.
Sir, you
Thank you,
please.
MP Sharma, sir. Thank you, Ravi ji. Thank you, Ravi ji. Ravi ji, can you ask to the Dr. Patel, the mental symptoms are the more important in the vertigo. जिनके जिंदगी के
Sir,
अंदर से रंग चले जाते हैं उनको ये प्रॉब्लम आती है
but
जिनके
due
जिंदगी
to
के
the
अंदर खुशियां
electricity technical issue, sir, due to
after
technical
that
issue,
after that
I will
when you
ask you.
contacted with the person then
Okay, sir. Okay, I will
and
correct.
what is the role of the after pregnancy in hyperpigmentation
Yes, sir.
sir
You're right, sir.
thank you sir
Yeah.
thank you
अभी आप रहिएगा सर. रवि,
अब
Presentation.
presentations आगे बढ़ाएं सर.
हाँ.
Can we start with the students' presentation? JVN Devina की presentations थी उसे complete करें सर. And then we
करा
have
दो
also.
start.
जी सर.
हाँ.
Namaste. A very good afternoon to Honorable Chairperson, sir, Dean and Director of Faculty of Homoeopathic Science, Dr. M.P. Sharma, sir. I, Devina Vachaspati, BHMS internee, is here to bring all the focus on the topic on the disease style. Role of homeopathic in style. Style is a bacterial infection or inflammation of meibomian gland of eyelids. It is a similar to boil or a pimple. Style is a red, painful lumps at the edge of
बेटा,
the. Yes, sir.
देवेना,
Yes, sir.
where is your presentation? PPT presentation.
Is it visible, sir?
Is it visible, sir?
Can
नहीं
you
आ
see
रहा
the
है. No.
8 minutes?
Yes.
Sir, can I leave the screen?
Is it visible?
Yeah. Devena, please stop it right now. Dr. Patel, there is
Yes,
a
sir.
question for you.
Yes, sir.
What is the mental symptom?
Mental symptoms, here it is the whole
हाँ.
pigmentary disorders that falls into the one-sided disease. and in one-sided disease, at least we should pay attention towards the pathological aspect of the medicine and pathological aspect of the allied aspect. So aphorism 106 and 217, that will guide us, and local melody 264 onward. Here you can treat the cases with these kind of the medicines. Means those medicines are very capable to produce the such kind of the lesion we can utilize with a very success rate.
In case of the hypopigmentation and
Yes, sir.
hyperpigmentation,
Yes, sir. I have taken
the
lots
same
of
thing is
result with
there.
a. Yes, sir.
Mangan sir,
Hyper.
any question?
Yes.
Hello, hello,
Yes,
Dr.
sir.
Patel. How are you?
Yes, fine, sir. Glad to see you.
Okay, sir. Thank you, sir. Sir, I
Ah,
want to know about the hyperpigmentation after delivery
okay.
and pregnant women
Yes, sir.
and role of the vitamin. What are the role of the vitamins at the time? Vitamin deficiency at
Yes.
the time. And one more
Yes.
thing, I want to ask for the viewers,
Okay.
uh, which mayas we are doing. Mayas.
Here, psychotic miasms are there, and for that, we have a best medicine that is related with the sepia, sulfuric acid, carboanimalis, and later you can place intercurrent medicine thuja. Thuja 200 to 1 m 10 m. You have to give intercurrent in a higher potency. So ultimately, you will be able to see. I have placed the cases with the before and after the photographs. So you
Yes.
can,
Yes, that is
yes,
better. That is better. Thank you, sir.
intercurrent
Thank you.
Thank you,
medicine
sir.
204
Thank you.
aphorism. Yes, sir.
Thank you very much, sir. Patel
Thank you,
sir.
sir. Yes, sir.
बहुत सुंदर रहा
Terrific.
आपका पीपीटी प्रेजेंटेशन
Yes, sir.
and it was very nice for our students as well as our faculty member.
Yes. Yes,
They
yes.
can
Thank you,
go
sir.
through that and they can
Yeah.
understand about
Yes.
your
It is
topic.
vast subject, and
Yeah.
in
It's all right.
15 minutes,
Thank
sorry,
you so
30
much, sir.
minutes. Yes,
Thank
sir.
you so much,
Thank you
sir.
so much.
Please
Thank you.
remain
Thank you.
remain with us.
Okay, okay,
Now,
sir.
Dr. Ravi, power presentation,
Yes, sir.
PPT presentation of the students, you can start.
Yes, sir. Yes, sir. Okay.
Sir, the presentation for students is over now. Can we
Yes, sir.
start with the presentation of faculty members, Dr. JC ma'am and others?
Okay, sir.
You can
There are no
start with
more
the
students
faculty
further.
member.
Okay.
Start with the faculty members, then remaining the student interns, that afterwards.
Okay,
Yes,
sir.
sir.
So I'll
Start.
call Dr. JC John ma'am for our presentation.
Pardon?
Respected advisor come CEO sir, registrar ma'am, and dean sir, and all the dignitaries present on this platform and students.
Voice,
To all,
voice.
namaste to all of you. I am Dr. G.T.C. John, Assistant Professor, Faculty of Homeopathy Science, Jyoti Vidyapeeth Women's University. Today I am presenting a research paper that is titled An Outcome Study Comparing Effectiveness of Homeopathic Medicine Magnesia Phosphorica 30C and Conventional Medicine in Cases of Primary Dysmenorrhea. And little bit background is the primary dysmenorrhea is a spasmodic painful affection of uterine muscles in course of menstruation. Primary dysmenorrhea is most common gynecological problem in menstruating women. Various studies prove that beneficial effect of homeopathic treatment in case of dysmenorrhea. Aim, objectives, and study design of the research. Aim was to compare the effectiveness of homeopathic medicine with conventional medicine in the management of primary dysmenorrhea.
Sorry for
Objectives
interruption,
to
ma'am.
compare the effectiveness of homeopathic medicine
Sorry
in
for
the management.
interruption. JC ma'am, do you
Yes, sir.
have PPT presentation?
Yes, sir.
Please show me.
Is it visible or not?
Not visible. Yeah, it's all right.
Okay.
Start,
Objectives
ma'am.
to compare the effectiveness of homeopathic medicine, magnesia phosphoricum, in the management of primary dysmenorrhea in comparison to conventional medicines by using visual analog scale as an assessment scale. Study design of this research, it was randomized, competitive, and experimental or interventional study. Hypothesis. Null hypothesis. There is no difference between the homeopathic medicine and conventional medicines in treatment of primary dysmenorrhea. Alternative hypothesis. There is difference between homeopathic medicine, magnesia phosphorica 30C, and conventional medicine in treatment of patients of primary dysmenorrhea. Materials and methodology. Study setting. The study was conducted at the OPD of University Hospital GVW Jaipur, and duration was 12 months, so that minimum 6 visits or observations can be obtained from the last case. Selection of sample. Out of 110 screened cases, we selected 70 cases. By random sampling method, we allocated two groups, group A, that was the homeopathic medicinal group, and group B, that was the conventional medicinal group. Data analysis was done using visual analog scale. Study design. Case of primary dysmenorrhea reporting to OPDs, obtain consent, and screening as per inclusion and exclusion criteria. And after case taking and all the baseline investigation, they allocated two groups. One group is the homeopathic medicine, and second is conventional medicinal group. Reassessment taken at the period of 1 hour up to 50 days at the need of the patient. Statistical tool were paired t-test and t-test for difference of two means for independent sample respectively. The analysis has been done on IBM SPS 20. In this study, sample size 70 was taken, but the statistical analysis was done with 63 patients due to the 7 drops out during the study. So degree of freedom is 61 and level of significance is 0.05. Now results and observations. A paired sample T test was conducted to compare the improvement before and after treatment in both arms of the study, and it suggested that group A and group B are statistically significant. Values for group A T 23.603 and P value less than 0.05, and P value for group B 19.932 and P value less than 0.05. An independent t-test was conducted to compare the after effect in the in between two groups, and results suggested that there was statistically significant difference in score group A and group B. For group A, mean is 8.16, standard deviation 0.723, and for group B, mean is 7.87 and standard deviation 0.922, and degree of freedom 61 and t value is 2.723 and p value is less than 0.05. Hence, we rejected null hypothesis and accepted alternate hypothesis that there is significant difference in effect of homeopathic medicine and conventional medicine in treatment of primary dysmenorrhea. There is some observation on the various factors, socio-demographic distribution. Among 63 cases, maximum cases were related to unmarried female group, that was 87%. and most of the cases are related to 11 to 18 groups, that was the 69%, and most of the cases that belongs to the rural area, that was the 80%. Improvement in pain, that is based on the VAS scale. The group receiving homeopathic medicine showed marked improvement 68%, and moderate improvement 25%, and mild improvement 6%, compared to group receiving conventional medicine, marked 32%, moderate 58%, and mild 38%. So marked improvement was higher in homeopathy interventional group. Improvement in flow and regularity of menstruation. Menstruation of 90% cases in homeopathic group. Menses became more regular, and 68% cases in same group menstrual flow become more normal. Discussion. In this study, it was found that in group receiving homeopathic medicine, 68%, that is marked improvement, and moderate 25%, and 6% mild improvement, compared to conventional group, and it's showing that percentage improvement was higher after receiving homeopathic medicine than conventional medicine. One of the very important one of the very important fact that was found in this research, due to effect of homeopathic medicine, not only symptoms of pain but overall well-being of patients improve, whereas conventional medicines are anti-inflammatory or antispasmodic medicines. Hence, it reduced pain intensity but lack in improving general well-being of patients. Now, conclusion. In this study, it was concluded that predefined homeopathic medicine Magnesia phosphoricum 30C was found more effective than conventional medicines in management of primary dysmenorrhea. So, this is all about my research. Thank you.
Thank you, Jesse ma'am. The topic was very nice.
Thank you, sir.
Next.
Thank you, Dr. JC John, for a very nice presentation. Sir. Yes, sir. Sir, please unmute yourself, sir.
I want to ask some questions from the doctor.
I'll just call her back.
Of
I'll just call her back.
Yes, sir.
Doctor, very nice presentation. Very nice presentation. You have done very well. But I want to know pathological investigation. Pathological test is this not dysmenorrhea is occurs due to fallopian tube, two-state fallopian tube, ovarian cyst, PCOD, whatever
Yes.
this is,
Yes.
you have not mentioned yet this thing. That was I want to ask, and you
Yes.
put your in study
Actually,
before
sir,
and
that was
after that.
excluded area. That is excluded criteria. If any
Yeah.
pathology in the cases, we rule out all these cases.
Thank you very much. Very nice.
Thank you. Thank you.
Now I would request Dr. Lekhika to present her presentation. Dr. Lekhika will be next.
Namaste. Respected CEO and advisor, sir, registrar ma'am, dean director, sir, and all faculty members and all dignitaries. My topic of presentation is effectiveness of homeopathic medicines in bronchial asthma in pediatric age group. Bronchial asthma attacks all age groups, but children are affected often. It is characterized by recurrent attacks of breathlessness and wheezing, which differ in severity and frequency from person to person. In an individual, they may vary in days or in hours. This condition is because of the inflammation of the air passages in the lungs and affects the sensitivity of the nerve endings in the airways, so they get easily irritated. In an attack, the lining of the passages swells and cause the airways to narrow and degrade the flow of air in and out of the lungs. Recurrent asthma symptoms frequently cause uh, recurrent
Dr. Parul, please mute yourself.
So I'm continuing. Recurrent asthma symptoms frequently causes sleeplessness, daytime fatigue, reduced activity levels, and don't let children to go to school and do their day-to-day routine work. According to WHO, many different factors have been linked to an increased risk of developing asthma. Although it is often difficult to find a single direct cause, asthma is more likely if other family members have asthma previously. Urbanization are also associated with increased asthma prevalence, probably due to multiple lifestyle factors. These include low birth weight, prematurity, exposure to tobacco smoke, and other sources of air pollution, such as viral respiratory infections. Exposure to a range of environmental allergens and irritants are also thought to increase the risk of asthma, including indoor and outdoor air pollution, house dust, mites, moles, and occupational exposure to chemicals. Children and adults who are overweight and obese are also at greater risk of asthma. Now, what was the need for this study? According to WHO, asthma affected an estimated 262 million people in 2019 and caused 461,000 deaths. Asthma is the most common chronic disease among children. Inhaled medication can control asthma symptoms and allow people with asthma lead to normal active life. Even avoiding asthma triggers can also help to reduce asthma symptoms. Most asthma-related deaths occur in low and low middle income countries where underdiagnosis and undertreatment is a challenge. Now, homeopathy can also help in improving quality of life of the asthma patients, especially in children, and even prevent death in India, where we still struggle for healthcare facilities being cost-effective and gentle mode of treatment. So, according to this study, uh, 43 cases of asthma were treated, and in between the children between age to 6 to 10 were more affected than other age group. We see in this case, 18 medicines were taken, and most medicine which was used was belladonna, bryonia, rustos, and hipazole. Summary and conclusion. This study has illuminated the impact of homeopathic medicine in asthma. Homeopathic holistic concept of treating not only the disease but the person as a whole is expressed by beneficial results in improving cough, wheezing, shortness of breath, asthma attack, and chest pains. As per the totality of symptoms, 18 different homeopathic medicines was prescribed, out of which Bryonia, Belladonna, Lustox, Cipasol, and Pasitilla, the most prescribed medicines, and show their effectiveness. Thus, this perspective observational study shows the positive role of homeopathic medicines in managing bronchial asthma in pediatric age group. Thank you.
Lekika madam, there is one question for you. Except those medicines, there is no medicine in our homeopathy for the asthma.
So please repeat. So these were the medicines which were selected according to individualization.
Okay. But except these medicines, there are many medicines
Yes,
which
sir.
can cure, which can
Yes.
cure very rapid, gentle and permanent.
Yes, sir.
Can you explain me any medicine, one medicine?
Sir, yes, I do the name of Blata orientalis. Blata. So,
Any other?
and, huh? Sorry,
Any
sir.
other medicine? Blata and any other medicine?
So, carbo wedge can be used in condition where there is emergency regarding the oxygen supply, and there was one more medicine which is being inhaled. I don't
Seneca
exactly remember.
Q. Seneca Q.
Yes, sir.
Or Cassia saginata Q.
Thank you, sir.
And other medicines are over there. Pankaj sir, any question?
Sir, please unmute yourself first. Pankaj sir, please unmute yourself.
Hello, Dr. Saab, you have done very well.
Thank you, sir.
Just I'm asking you, why don't you use pathological test, blood examination, X-ray test, CT test, CPR, whatever that is. It is bronchial asthma in this scenario is very close to corona. And lastly, what happened? What happened in this bronchial asthma? There is the lack of oxygen. And which medicines are
Yes, sir.
useful in to carry oxygen? So kindly do it. Carbovage, veratrum album, come validinum, arsenic album. So many medicines are there. So please related with the pathological test
Thank you,
after
sir.
finalizing.
I'll do it in next study, and it was majorly individualized medicines.
Okay,
Thank
okay,
you.
okay. ठीक है.
Thank you, sir.
Thank you. Next.
Thank you, Dr. Lekika. We have now some of our paper presenters from the outside, JBW. We have Dr. Parul Dwivedi. Dr. Parul, please start with your presentation.
In short.
Dr. Parul, please unmute yourself. Dr. Parul?
Good afternoon, sir.
Yes. Now
Sir,
I will
this
be
is
sharing your presentation.
okay,
And
sir.
Dr. Parul is basically PG resident and in Department of Homeopathy Materia Medica from State LBS Homeopathic College, Prayagraj, Uttar Pradesh. So she will be presenting her presentation now. I'll be sharing the PPT. Dr. Parul, please be a little quick because we have lots of other presentation also.
Sure, sir.
So,
Dr. Parul,
Yes, sir.
you have given
Yes.
5 minutes only.
can you
Sure,
see
sir.
this
Sure,
presentation,
sir.
Dr. Parul?
Yes, sir.
Okay, start with the presentation.
Okay. Good morning, sir. Good morning, directors. Good morning, all faculties members. This is me, Parul Divedi, which is pursuing MD from State Lal Bahadur Shastri College, Prayagraj. So my presentation is on mesenteric lymphadenopathy. The title is Role of Individualized Homeopathic Remedy in a case of mesenteric lymphadenopathy. This is a case study. So we proceed on abstract. The first of all, I want to explain about what is mesenteric. Mesenteric is refers to the inflammation occurring in the mesenteric that attaches your bowel to the wall of your abdomen. The mesenteric lymphadenopathy is the inflammatory condition of the lymph node of intestine. It is mainly due to an infection, or they could be a symptom of sorry could be a symptom of condition and that cause inflammation. So in our OPD, mesenteric lymphadenopathy is one of the most common cases, और that's why I मतलब मैंने ये इस चीज इसे एज अ आर्टिकल सोचा और इस पे काम करना स्टार्ट किया. तो मेरे पास एक केस था, एक बच्ची थी जो 8 साल की थी और उसे mesenteric lymphadenopathy था और 5 मंथ से ये केस मेरा चला था. और इसमें ऑन द बेसिस ऑफ इंडिविजुअलाइजेशन मैंने सल्फर की 200 में डोज दिया और उसके साथ ही ये केस क्योर हुआ. अगर हम इंट्रोडक्शन पे जाते हैं तो सबसे पहले मेसेंट्रिक लिम्फेडेनोपैथी का इंट्रोडक्शन अगर हम देखते हैं तो ये होता क्यों है. सर बेसिकली ये क्या होता है, मेसेंट्रिक लिम्फेडेनोपैथी लिम्फ नोड का एनलार्जमेंट होता है. जो मेसेंट्रिक पार्ट होता है जो एब्डोमेन को इंटेस्टाइन से जोड़ता है, वहां पे अगर इन्फेक्शन की वजह से लिम्फ नोड वगैरह बढ़ जाते हैं. इसका मोस्टली जो होता है ये केस जो है मिस्टेकन कर देते हैं हम एक्यूट अपेंडिसाइटिस के केसेस में. जनरली ये बच्चों में होता है और हम इसे क्योंकि इनका जो पेन होता है, इनका जो प्रेजेंटेशन होता है, दिस इज क्वाइट सिमिलर टू एक्यूट अपेंडिसाइटिस. और इसमें बहुत सारे इन्फेक्शंस होते हैं लाइक वायरल इन्फेक्शंस, बैक्टीरियल इन्फेक्शंस, फंगल इन्फेक्शंस. और मोस्टली मैंने जो यहाँ सर ओपीडी में देखा है, अक्सर पास्ट हिस्ट्री में लोगों के ट्यूबरकुलोसिस के इन्फेक्शंस वगैरह देखे गए हैं. इसके साथ ही पेशेंट में टाइफॉइड वगैरह के इन्फेक्शंस जो प्रीवियस हिस्ट्री में हमें जितने भी मिले, उस केसेस में मेसेंट्रिक लिम्फेडेनोपैथी काफी केसेस हमने पाए गए थे. मेसेंट्रिक लिम्फेडेनोपैथी इनका जो इनलार्जमेंट होता है ये मेलिग्नेंसी के केसेस में भी इनका इनलार्जमेंट जैसे होता है लाइक हॉजकिन लिम्फोमा, नॉन हॉजकिन लिम्फोमा. अगर हम केस स्टडी की बात करें सर, तो मेरे पास एक जो बच्ची आई थी वो 8 ईयर ओल्ड थी, मिडिल क्लास फैमिली की थी. जो प्रेजेंटेशन वो लेकर के आई थी सर, उसमें एब्डोमिनल पेन था, उसके साथ डायरिया था, लॉस ऑफ एपेटाइट था विथ सीवियर फीवर, मतलब सीवियर हाई ग्रेड फीवर था उनका. इसके साथ ही जब उनका एग्जामिनेशन किया तो देयर इज टेंडरनेस ओवर राइट हाइपोकॉन्ड्रियम. और उसके साथ ही उनमें जब उनकी रिपोर्ट देखी ऑन द बेसिस ऑफ यूएसजी, तो वहां पे 4 mm का लेफ्ट रीनल स्टोन भी था सर. इसके साथ ही जब केस को मैंने आगे लेना स्टार्ट किया तो पेशेंट की जितनी भी हिस्ट्री थी, फैमिली हिस्ट्री, पर्सनल हिस्ट्री, पास्ट हिस्ट्री, वो सारी हिस्ट्री जब देखी तो उसमें ये था कि जो पेशेंट थी उसकी फैमिली हिस्ट्री में फादर वाज क्वाइट हाइपरटेंसिव थे और मदर अस्थमैटिक थी. बच्ची की पास्ट हिस्ट्री में फंगल इन्फेक्शन था, स्किन इन्फेक्शन था. इवन जब वो आई भी, जो उसका फिजिकल जनरल कॉन्स्टिट्यूशन था, उसमें भी इरप्शंस उसके फेस पे बने हुए थे. इसके साथ ही जो बच्ची थी, जब उसका केस जैसे ही मैंने फॉरवर्ड किया, कैरी ऑन किया, तो उसमें मतलब स्ट्रॉन्ग डिजायर उसके स्वीट्स की थी, थर्मल उसका हॉट था, और मतलब जो पर्सपायरेशन था उसका क्वाइट ऑफेंसिव और प्रोफ्यूज था. उसके बाद से, और उसमें टेंडेंसी थी बहुत जल्दी जैसे भी मतलब कोल्ड वगैरह, वो इन सब के एक्सपोजर में जैसे ही वो जाती तुरंत वो कोल्ड वगैरह कैच कर लेती थी. उसकी जब एनालिसिस मैंने किया तो उसमें वही था कि उसकी एपेटाइट वगैरह उस टाइम लॉस थी, थर्मल उसका हॉट था, डिजायर फॉर स्वीट्स बहुत ज्यादा था, पर्सपायरेशन प्रोफ्यूज एंड ऑफेंसिव था. पर्टिकुलर्स में देखा एब्डोमिनल पेन, नोजिया, वॉमिटिंग, डायरिया, ये आफ्टर ईटिंग था. मेंटल जनरल की बात करें तो जो बच्ची थी वो बहुत ज्यादा एक्टिव, इंथुसियास्टिक, बहुत ही प्लेफुल टाइप की थी. जब भी मेरे सामने जैसे उसका केस ले रहे थे, पूरे टाइम खेलना कूदना, इधर उधर भागना, सारी चीजें करना. तो यहाँ पे सर मैंने जो रूब्रिक्स उठाए थे, दैट वाज एक्सट्रोवर्ट, रेस्टलेसनेस, क्यूरियस. क्योंकि क्यूरियस ये था कि हर चीज के बारे में क्वेश्चन पूछना, हर चीज को ऑब्जर्व करना, हर चीज से रिलेटेड क्वेश्चन पूछना. प्लेफुल मतलब हमेशा इधर उधर भागना, दौड़ना, कुछ ना कुछ खेलते रहना. और अपनी इस हरकतों की वजह से वो सबके अटेंशंस को अपनी तरफ कैच कर लिया था उसने. दैट्स व्हाई आई पुट द रूब्रिक चार्मिंग अदर्स. उसके बाद मतलब उसकी जो हॉबीज वगैरह में देखा गया तो डांसिंग वगैरह में मतलब वो बहुत अच्छी थी. तो उसको रिपर्टराइज करने पे सल्फर टॉप ग्रेड पे आई, और इन मतलब फिजिकल जनरल्स को देखते हुए सल्फर 200 एक डोज दिया एंड केस वाज फुल्ली क्योर्ड ऑन 31st March एंड मेडिसिन वाज स्टॉप्ड.
Madam, what
और
was the pathological investigation required?
सर पैथोलॉजिकल इन्वेस्टिगेशन वाज ओनली यूएसजी रिपोर्ट. यूएसजी में सर 7 to 9 mm का मेसेंट्रिक लिम्फ नोड दिख रहा था, और उसके साथ ही सर सिम्टम्स भी सारे वही थे, फीवर,
But
वॉमिटिंग.
you have mentioned here renal calculus.
सर रीनल कैलकुलस वाज आल्सो देयर.
हाँ, तो आपने उसका यूरिन एनालिसिस करवाया क्या, या सोनोग्राफी करवाई क्या?
सर यूरिन एनालिसिस वगैरह तो नहीं कराया था सर.
Thank you so much.
Thank you sir.
Next, we
Next.
have Dr. Jaita. Dr. Jaita, please be ready for your presentation. I'm going to share your PPT with you. Can you hear me, Dr. Jaita?
Yeah. Am I audible?
Yes, you are audible. I'm just going
Yeah.
to share your PPT, and then
Okay.
you can present your PPT. Dr. Jaita is a homeopathic medical officer from Government of Homeopathy Dispensary, Gurugram, and she is going to give a presentation. So I'm just sharing the presentation with all of you. Dr. Jaita, can you see the screen? Can you see the PPT?
Not yet, sir.
Can you see it now?
No, sir. It's
Just a
fine.
minute. Hold on.
I can just say.
Just introduce yourself, and I'll just let this PPT on. Just introduce yourself first.
Okay.
No,
Okay.
she has given in my mail.
Okay.
Yes.
It is visible now, sir. Thank
Yeah.
you, sir, for this
Start
opportunity.
within
I am
5
Dr.
minutes.
Jaita Chaudhary.
Ma'am, please continue.
Okay. Uh,
Continue with it. In summarized way.
Thank you for this opportunity. I am Dr. Jaita. I am a homeopathic medical officer posted in CHC GHD Helimandi, District Gurgaon. Today I'll be presenting my case on social anxiety disorder. This case was this study I have done on 5 patients under my internship in DIPR, New Delhi, and the मैंने इसमें होम्योपैथी एज वेल एज माइंडफुलनेस टेक्निक्स जो साइकोलॉजी इंटरवेंशंस के अंदर आते हैं मैंने दोनों सिस्टम को अप्लाई किया है along with social skills relaxation techniques and the result was very and the results I've received was very good. So social anxiety disorder is less of a sad expression and more of a shy expression. It is a chronic debilitating mental illness characterized by a marked and persistent anxious fear related to one or more social or performance situation involving reflection of negative facial expressions and exposure to familiar or unfamiliar situation. The aim of the study that was completed at DIPR DRDO is to study the concept and literature of social anxiety disorder, to understand the application of social anxiety questionnaire for adults, SAQ 830, test anxiety inventory for analysis of social anxiety among patients, to understand the continuum and relation of social anxiety with suicidal ideation attribute scale, Beck's hopelessness scale, and others, to understand the application of homeopathic treatment as main intervention in SAD using homeopathic repertoire, rubrics analysis, and case taking. To understand the psychological interventions, including mindfulness, applied relaxation yoga techniques, social skills training in social anxiety disorder. The test subjects were obtained from various hospitals and polyclinics from District Gurgaon. After following up with each case, the references were drawn, thus obtaining average score from both test anxiety inventory and SAQ 830, including both pre and post treatment. They were given homeopathic medicines along with various psychotherapies, including mindfulness log sheets. The prevalence ratio was found to have females suffering more as compared to males. The graphs obtained thus reveal that patients need proper counseling over a long period of time, especially to go for social skills training. Practicing mindfulness and applied relaxation techniques was found very much beneficial and overall improved major stress level and quality of life. So the next presentation, sir, kindly next PPT. The prevalence has shown the 2008 National Comorbidity Survey provides prevalence estimates of 12 months and lifetime prevalence of DSM-4 as 7.1% and 12.1% respectively, with a higher prevalence in females. And the various other comorbidities that are found in SAD patients are major depression, alcohol abuse, specific phobia. In India, the prevalence is 2.79%, and the 50 to 80% of people with SAD presenting to health services have at least one or other psychiatric conditions, especially substance abuse cases. Now, the continuum of social anxiety disorder contains first the phase is anticipatory phase, shyness,
Please
contemplating the
be a
situation and
bit
overthinking.
specific. We do not have so much time now. Please.
Sir, just 2-3 minutes time. I won't take much time. The second phase includes situational exposure. The third phase includes post-event processing.
Dr. Shivan Shah, I
So
welcome
the
to you again today, post-lunch conference.
Okay, so the psychological assessments that were taken are test anxiety, social anxiety questionnaire, adults, suicidal ideation attribute scale, and Beck hopelessness scale. Now, one of the case I'm presenting here is carcinosin. So the main rubrics that I've taken here is mind, traveling desire for, mind, ambition increased, mind, biting nails, mind, anxiety, crowd in, that is a 3 plus, mind, confidence, want of confidence, mind, timidity, mind, sensitive to criticism, mind, pleasing, desire to please others, mind, suicidal disposition, dreams, nightmares, besides other physical journals. So these are the very few, very common mental journals that we obtain in social anxiety patients. So to conclude the case, I would just say after the pre-treatment and post-treatment analysis, that mindfulness technique and homeopathic treatment was found to be most effective line of treatment in SAD patient. Social anxiety disorders are major concerns these days among psychiatrists and psychologists. Such are highly treatable with homeopathic medicines with thorough case taking along with combined psychotherapies. The final outcome revealed improvement after comparison of both pre and post scores in all the five cases. The intensity scores show significant reduction, and patients revealed that they found homeopathic medicines and especially mindfulness techniques very effective and safe. Considering the nature of social anxiety disorder, the improvement of cases should not be followed for sufficient period of time, and it was time-bound study. Sample size was limited to 5 cases, and many other patients denied to answer the inventories. Cases of SAD combined with substance abuse and severe organic diseases were excluded. The prevalence ratio, as I said, was more in females as compared to males. The graph obtained revealed patient need proper counseling, and practicing mindfulness and applied relaxation techniques was found very much beneficial and overall improved
Dr.
major
Jaita,
stress and quality of life. Thank you, sir.
time is over now. And we have again our renowned guest, Dr. Shashi Mohan Sharma sir. Namaste, sir. Welcome.
Namaste. Some sound is breaking. I don't know whether you can hear me.
Yes, sir. We can hear you clearly, sir.
Can I rejoin it because there is some problem with the internet? The sound is breaking
No
here.
problem, sir. No problem.
I will join within a second. I will cut off. Then I join again.
Okay, sir. Dr. Gunjan, you can start your presentation. Please be a bit quick. Dr. Gunjan.
Yes. Good morning, sir. Good afternoon, sir. Yes, sir.
Good afternoon. She's a MD PGR from Government Homeopathy Medical College, Bhopal. So please be a bit quick in completion of your presentation.
Sir, can I leave?
Dr. Jaita, your time is over, please.
Okay, sir. Thank you, sir. Thank you so much. Okay.
Yes, sir. Good
Dr.
afternoon,
Gunjan,
all of
please.
you. Yes, sir. Yes, sir. Am I audible, sir?
Yes, sir. You are audible. Please be a bit quick. Just tell us about the summary of your paper because your paper
Yes.
is very lengthy that you have given.
Yes,
Just
sir.
tell us
My
about the
title
summary.
is Utilities of Modalities of Brainia alba. In this,
Yes.
मुझे जो बताना चाहा है वो ये बताना चाहा है कि जो भी ब्राइनिया की मॉडलिटीज हैं उसको अगर हम बेस बना रहे हैं तो हमको क्या रिजल्ट मिल रहा है. तो modalities are the introduction part is modalities are one of the characteristic symptoms which help to find out prescribing totality in the case of disease. Most of the time, these character features are voluntarily narrated by patient himself or observed by homeopathic physician. Utilities of modalities explained by different stalwarts are Boyning was
Dr. Gunjan? Dr. Gunjan, can you hear us? Dr. Gunjan?
Hello?
Yes, sir. Continue, Dr. Gunjan. Your voice was not proper, so please continue.
Now audible, sir?
Yes, sir. Yes, yes. Please continue, Dr. Gunjan.
Yes. Fifth is pure, sixth Quemado, seventh Quendo. But Quemado and Quendo are discussed which are related to the topic. Quemado, it means the modifying factors, means the factors which aggravate or ameliorate a particular condition. It does not include the time. And in Quendo, it means the time of appearance of the aggravation or the improvement of ailments. According to Dr. Samuel Hahnemann, sir, Dr. Hahnemann discussed about modality in organ of medicine, aphorism 82 to 104. especially in aphorism 86, 89 footnote, 93 footnote, 94 footnote, and also in aphorism 133. According to Dr. H. Roberts, if in analyzing the case, very valuable symptoms are those pertaining to the aggravations and aberrations, because the aggravations and aberrations are the natural modifiers of disease states and are the definite reaction of the man himself. सर कुछ केस स्टडीज हैं जो मैं
Dr. Gunjan, can you hear us?
Yes, sir.
Just be a little quick. Just tell us about your case.
Yes, sir. Yes, sir. Sir, first case is patient had fever and body ache since last evening. Ailments from after drinking sour fruit raita, had also had sore throat headache. इसमें जो मॉडलिटीज का बेस था वो था कि एग्रावेशन फ्रॉम exertion and ambulated after rest. My prescription was Bienia 200 OD for 2 days. इसका जो फॉलोअप आया उसमें पेशेंट को रिलीफ था. सेकंड जो केसेस है, ए पेशेंट हैड सीवियर हेडेक विद वॉमिटिंग सिंस लास्ट 2 days. इसका एलिमेंट फॉर्म था एक्सपोजर टू सनहीट ड्यूरिंग ट्रैवलिंग. तो मॉडलिटीज के बेसिस पे सारी कंप्लेंट्स एग्रावेट फ्रॉम नॉइज एंड एक्सर्शन, एम्बुलेशन फ्रॉम रेस्ट, डार्कनेस एंड बैंडेजिंग. My again prescription is Brinia 200 OD for 3 days. And next my case is a patient had cough since 10 to 14 days more at night. Patient was facing difficulty in expectoration with congestive feeling. Concomitant symptoms were feverish feeling, also based on modalities, aggravation from physical exertion and better from expectoration. Uh,
All right, Dr. Gunjan, thank you very much for your presentation. I think your voice
Okay,
is
sir.
not proper, but thank you for a very good
Okay.
presentation. Now,
Okay, thank you, sir.
I will go to the last presentation. The last presentation is my own presentation. Uh, Let me share my presentation with you. Myself, JVN Dr. Ravi Jain, Associate Professor and HOD, Department of Practice of Medicine. I'm also a PhD scholar in Homeopathy University, and I'm doing my PhD from Organon of Medicine. And the topic for my thesis is efficacy of indicated homeopathic medicine in the management of primary dysmenorrhea using VAS and valid score. This is a sequential controlled study. I will not be taking much of your time. Actually, work on dysmenorrhea, primary dysmenorrhea, has been done by a lot of people in the past. But what is novel about this research is this is a sequential controlled study. What is sequential controlled study? Sequential controlled study is a study in which the same participant will be given first placebo, and after 3 months or 3 follow-ups, the patient will be prescribed indicated homeopathic medicine, and then the efficacy of indicated homeopathic medicines will be established. So we will be using two scales, visual analog scales and valid scale, that will assess the quality of life. So in this particular research, I have taken, this research is ongoing, and I am taking the research study at Suryansh Arogya Homeopathic Hospital and Research Center at Jyoti Vidyapith Women's University. I have taken 65 cases because the sample size calculated by the statistician is around 65, and therefore I have taken 65 cases, and the follow-up is still going on. So I have taken the cases. I have prescribed 3 months placebo. The patient is not aware about the placebo, and then I have taken the follow-ups. I have, while including the cases, I have used the inclusion criteria and the exclusion criteria mentioned here, and I have also taken into account the withdrawal and the discontinue criteria. All the cases are taken from the patient who are coming in the OPD of Suryansh Arogya Homeopathic Hospital. I have collected all the data, but the processing part is still remaining. So I cannot come at the result portion at present, because the collection and compilation of all this data is still going on. I'm using two scales, visual analog scales and valid scale, so for the assessment of the data. So this is one of the presentation in between, when I'm just telling about the work that I'm doing and about the sequential control study. So this is the visual analog scale for pain mild to worse, and this is the valid scale, which is showing working ability, location, Wong-Baker intensity, and pain duration. So outcome assessment will be was taken at 0 week, 4 week, 8 weeks, 12 weeks, 16 weeks, 20 weeks, and 24 weeks. So this is about the summary, the brief summary of the work that is being conducted by me. Still, this work is going on, and as soon as I get the result, I'll be showing the result with you. So this was all about the presentations for today. I think I have completed all the presentations, and Dr. Shashimohan Sharma sir was going to join. So we will be waiting for him, and over to you, Dean sir.
Thank you, Ravi. This was very nice presentation. Go ahead. Next.
Sir, we do not have any presentations for now. We have completed all the presentations. A few guests from outside had to come, but they could not join because of the time issues. So, Dr. Padampriya Nair ma'am is here. What are your remarks, ma'am? If you can say something at the end. We have tried to
शशिमोहन शर्मा
conclude.
सर चले गए क्या?
अभी थे sir, and I'm still waiting for him because yesterday also he could not talk much. So I'm waiting for him to give his views today on
पंकज
this
सर भी चले
conference.
गए. पंकज सर.
पंकज सर भी गए. आप प्लीज एक बार बात कीजिए उनसे because I'll just try to contact the other speakers if it is possible, so that the presentation can happen. I'm sorry, the mic was off. So, Jyoti Vidyapeeth Women's University is a university that is working on the motto education, that is having a motto that education for community development leading to education for quality. I'm sorry, I just.
Dr. Ravi.
Yes, sir.
Dr. Ravi, Pankaj
Yes,
Sharma
sir.
sir already in the studio.
He is in the studio.
And Shashimohan Sharma sir very soon joining.
I'll just check, sir. Just 1 minute.
Okay. Yes, sir.
So,
साहब आपकी आवाज नहीं आ रही. I can't hear you.
नहीं समझ में आ रही, आवाज नहीं आ रही है.
Very faint. I rejoin again right now. I will cut off and join again.
Okay, okay. Dr. Pankaj Sharma sir also is there. He is along with you.
I will join within a minute.
Dr. Pankaj Sharma को देख लिया आपने? पंकज सर.
नेटवर्क इशू है सर के साथ में.
पंकज सर. पंकज
सर
शर्मा सर.
प्लीज कॉल कर लीजिए उनको. आई थिंक ही इज हैविंग नेटवर्क इश्यूज. I was talking about the motto or the mission of this university, education for community development leading to women empowerment. So this is the motto of Jyoti Vidyapeeth Women's University, and this university is working day and night for achievement of this motto. Our honorable founder and advisor, sir, had this vision to make this university the topmost university of the country, and not only in the country but also a very renowned university throughout the world. And therefore, he has incorporated the habit of research work in the students and in the faculty members. In this 2 days workshop on advancement in homeopathic research, including clinical trials, lab studies, and lab researches and case studies, we have we have listened to various renowned speakers who have given their various experiences related to clinical trials. They have shown about various laboratory research and case studies. So, now we are again waiting for our renowned guest, Dr. Shashimohan Sharma sir. He will be joining shortly, and Dr. Pankaj Sharma sir also will be joining shortly, and then we will be able to listen from them.
Dr. Pankaj Sharma sir has told me he is in studio.
Just a minute, sir. I'm just check it again. There is a little bit network issue, but shortly they will join. And I have asked the technical team to please rejoin them as soon as they join, so that they do not remain in the studio and they actually come on screen. So I was talking about the research practices that are being practiced at Jyoti Vidyapith Women's University. From the first year itself, the student is encouraged to take part in the conferences. The student is encouraged to start writing a paper, although the student does not understand. But by taking part in such conferences, they get insight about the papers. And then from the second year onwards, we are asking the patients the students to present their papers, and during internship, they are publishing their papers. Dr. Shashimohan Sharma sir, can you hear us, sir?
Yes, I'm back.
All
Now
right, sir.
I can
Welcome
hear
back,
you.
sir.
Dr. Parul, I am audible. Dr. Parul,
Yes, sir.
please leave the session.
Dr. Parul, your session is over. You have already presented.
Okay.
Now we have our eminent guest, Dr. Shashimohan Sharma sir. He is also the chief guest of this event.
Yes, sir.
And now on to you, sir. Please shower your blessings on us, sir.
I am always with you. My brother, Dr. Sharmaji, is conducting the program, and I'm very happy. Everyone is enjoying, and they are learning homeopathy. My saying is, we must stick to homeopathy as per the principles of Dr. Hahnemann. We should not deviate from Hahnemann's philosophy and teaching. And we will never fail. We only fail. Can you hear me again?
Yes, sir.
Yes, sir. We can hear you, sir.
Something is wrong now. I can't see the picture. But if you can hear me, I continue.
Yes, sir. We can hear you, sir. Please continue.
And
I'll give one information to you, sir. Dr. Padma Priya Nair is also with us.
She is a brilliant. She's like my family. She is very hardworking doctor. Dr. Padma is very intelligent and she is very honest in homeopathy. That's why I respect her, and she is always helping me. And she will be conducting our program in October as well. And she will give lecture. You will love to see her lecture today, and definitely she will give the best presentation, and everybody admire her. So I don't know whether you can see me or not, but my camera is not working. So I wish you all the best. I will rejoin again. I don't know what's happening with some problem with the internet.
Ask to Padma Priya Nair, ma'am.
Dr. Padma Priya Nair, ma'am, if you can hear us, what are your experiences? Dr. Padma Priya Nair, ma'am, can you hear us? Dr. Nair, ma'am, I think she's not there.
Okay.
She's not responding actually.
Something is wrong here in UK. Hello.
Ji, sir. Your voice is audible, sir. You can speak.
Okay.
Please, sir.
My
Yes,
saying is we must stick to Hahnemann's principles and follow the homeopathy as per his teaching, and we will never fail. I have rejoined you. So there was a problem with internet. I think is echo voice is echoing. I think it's a double link.
Dr. V.
Yes, sir.
Can I?
Sir is again here, sir. You can speak, sir. Dr. Shashimohan Sharma, sir.
But
Please.
my voice is echoing.
No,
It's
no, we
okay.
are listening. We are listening, sir.
It's better now. It's better. Thank you.
Yes,
So
sir.
what
Yeah,
I'm
yeah.
saying, we must stick to homeopathy and practice homeopathy according to the principles and teachings of our master, Dr. Hahnemann. Whenever we deviate from the teachings, we always fails. I admire the work of Dr. Hahnemann and my most respected Dr. Hahnemann, but the other doctor I respect is Dr. James Tyler Kent. I have read and studied the repertory for more than 1,000 times, and I admire the schema and the information which he presented in the Kent's repertory. That is the one of the best repertory in the world. Nowadays, they are augmenting this and they are adding more symptoms. And the work of Dr. Murphy and one doctor from Thailand, Rosenberg, and other doctors are working on the same repertory. But the basis of repertory is the best from Dr. James Tyler Kent. Boning Hassan is also good. Lippe, Ner, other doctors are there, Dr. Fatak. But the real good repertory is Kent's repertory. And Dr. Kunjali from Germany also made the special repertory with his personal recommendation for the symptoms, giving a black dot where he experienced and he confirmed this rubric is guaranteed, just like uh, Naxwamika. Anywhere proper proving and proper satisfaction after treatment, he put a black mark there. So if is any chance, you can find out Dr. Kunjali's repertory, synthesis repertory. These are the best repertories in the world. So my teaching is, my saying is, my recommendation is, my advice is, follow the master's teaching and you will never fail. Nowadays, there are a lot of doctors are doing the practice, but they are not following the Hahnemann. I'm surprised when very learned doctors are prescribing 3 remedies, 2 remedies at one go. Homeopathy should be practiced as per Hahnemann's teaching, but single remedy, simple single dose of high potency or low potency doesn't matter. But a single remedy, simple remedy, then you will get the result. There's no suppose that 3 people are talking, you don't know who is saying what. Here in the same way, all the homeopathic proving was done on the single remedies. And the materia medica is full of what a medicine Brania is telling, Rustox is not telling. What the Rustox is telling, the Brania is not telling. So we must not use more than one remedy at a time. We may follow the remedy, complementary remedy, but we should not give 2 remedy at a time. That is the thing which is spoiling homeopathy. There was a case from another doctor of eczema, and I asked for the prescription, and they said no prescription is not given for any treatment. But somehow I found the remedies were given like a graphitis, arsenic, clematis. This is not homeopathy. Homeopathy means single remedy at one time. As if you have only one name. You can have some pet name, but the real name is the real name. You can't say I have got 10 names. This is different. Just like in sun, we have hundreds of names for the sun. That is the Prayavachi. That is the other names for the same thing. But in homeopathy, there is no second name. There is single name for single remedy. Sulfur is sulfur. There are so many sulfur, calcarea sulfur, heper sulfur. That doesn't mean sulfur is sulfur. So I always say, please follow the Hahnemann's tradition and do not spoil homeopathy, because homeopathy is dying in many countries because of people are putting this combinations. I'm very surprised to see a lot of people, even they are qualified, they don't work hard. And they give the combination, just like for the cough mixture, there is a Brinia and Belladonna and Spongia and Hypersulf. There's so many things. This is all rubbish. They are spoiling the health and they're spoiling the name of homeopathy, and homeopathy is dying in this manner. I know there are hundreds and thousands of homeopaths in India, and every year we are educating maybe 5 to 6,000 or more than that homeopaths. But I recommend, I suggest that all of you study homeopathy properly, study organon of medicine, Hahnemann's chronic disease, and then practice according to his principle, and you will never fail. We only fail when we deviate from master's teaching. That's why there is a mongrel sect. I should not repeat. Sometimes people don't like it. If you're not doing homeopathy, suppose even if you are giving the homeopathic medicine, saying I'm giving the single remedy, but you're not working hard, you're not selecting a proper remedy, you're not matching the symptoms, you're not confirming the remedy, that means there is some failure. And the failure, you will say homeopathy failed. No, homeopathy will never fail. Dr. Hahnemann once said, sun may rise in the west, and if you are using my teaching and principles and you give the homeopathic medicine in the right potency at the right time, it will never fail. And if it fails, then go on the rooftop and say Hahnemann was mad. He was so confident. He was so knowledgeable. He was sent by God for the mankind. Even the doctor from America and UK, they know what Hahnemann did, but they don't accept it because they are practicing allopathy. And they are ashamed of accepting the truth that homeopathy works. Even the very highly educated people think homeopathy is the best in the world. There is one doctor, he's called Dana Ullman from USA. He made a book called Homeopathic Revolution. If you can find it, if you can buy this, you will see the vast information. More than 11 presidents from America was using homeopathy. More than thousands of musicians and scholars from all over the world. You will see the name. Even the Isaac Newton was using homeopathy. Everyone saying homeopathy works. Only illiterate, ignorant, and stubborn people who don't believe in homeopathy say homeopathy doesn't work. So they suffer. Let them suffer. If they don't trust us, let them suffer. When I joined Hahnemann, principles, I never failed. In 1967, when I got admission in the National Homeopathic Medical College, my father was true follower of homeopathy. My grandfather was a surgeon, but my father was a homeopath. So people were saying, oh, he is getting admission in the small pills, sweet pills college. And after 15 years, he admitted his own son in the Bhopal Medical College. And I was so happy that this young man was Naveen Saxena, Dr. Naveen Saxena, if he is listening anywhere. So he was following me after 15 years. And he wasted the 15 years. I confirm, I am very happy, I'm very satisfied. Homeopathy gave me everything in my life. I trust homeopathy, I trust Hahnemann. And moreover, our college patron, chief patron is Dr. Hahnemann's great grandson. Maybe he will see and meet our dear Dean Sahab in October. I'm asking him to join. He said, if I'm here in the UK, I will definitely see and visit you. So his name is Charles Tankard Hahnemann. And his father, William Tankard Hahnemann, was also very learned person. And I met him. And once Dr. Jawahar Shah from Mumbai came, and we both went to their house. And they gave us a good respect. We had sweets and coffee and whole day. And the best thing, we were touching the porcelain painting of Dr. Samuel Hahnemann. He has got the ring from Hahnemann, signet ring. Is a gold ring with a signet. We were so happy to touch that Hahnemann ring, just like a very pious, very religious feeling. And once he came to India and he bought that ring, and I insured that ring for £1 million in case it's lost or stolen. So you can see the value, because we know Hahnemann, we know homeopathy, we respect them like God. A lot of people, even in the United Kingdom, they say, oh, Hahnemann, they treat him like an honorary doctor. They don't give the credit as we give. We love and respect and we worship like a God. I remember Dr. MP Sharma Sahab gave one Hahnemann bust to one doctor, Dr. Brushwali Saraswat, I think, in in Mumbai, from Mumbai. And she took that memento and put in the prayer room saying, today God has come to my house. So this is the feeling. So I'm surprised how much people love. India is the country which work with the whole heart. It's not half-hearted. And that's why, without doubt, I say India is number one in the world in homeopathy. Doesn't matter where the homeopathy originated. Even Indian doctors are famous all over the world. Dr. Vijay Vaishnav ji in America, and then Dr. Rohit Sharma and other doctors are in Canada. Doctors in Belgium, doctors in America, Dr. Kiran Parekh. I know them. They are ruling the area and the science, medical science. Surprised how come they treat something which we can't treat. Even in India, we know a lot of things which the British people and English people and American people don't know. There is a special condition in the abdomen, which is called the umbilical displacement, called dharan in Punjabi. They don't know what is dharan. They don't know how to treat something. They can't treat the emotions and feelings like we do. Hahnemann was the master in mind and mental symptoms. We owe him everything. Sometimes I have tears in my eyes thinking of him, how much he gave us and we don't value. We must value Hahnemann's teaching. We must follow his principles. We must study Materia Medica Pura, chronic disease, and learn every day. Every day we have to learn something. It's no say I am completely knowledgeable in homeopathy. No one is completely fully knowledgeable in homeopathy. Even Hahnemann at the age of 82 was saying, whole life I have done so much, but I have to do more and more. Similarly, one doctor from America, Luke de Schaffer, he gave up his practice and now he's studying homeopathy at this age. I really admire him. I really respect him for his knowledge. And he is so knowledgeable, so intelligent doctor. I admire him. I respect him. I follow him. I give him full credit for what he done for the homeopathy. And his voice is not weak, telling you. When he speaks with the confidence and he give you full confidence. That is our job of the senior doctor and elder doctors, to give full confidence to a new generation. I never said try this. I said use this. There was a patient who came to me for some complaint and I said, I will try that, or give me medicine back. Why are you saying I will try this? It will make you better, definitely make you better. If we are not confident, then patients are not happy. They think I have given them some medicine for money. No, there's no money involved. But Hahnemann was very strict with the fee. You'll be surprised if I'm telling you something. He was giving medicine to a lot of people, but he was charging good fee. He said they should respect my medicine and my hard work. It's not saying take this medicine. I know one doctor, he was from Kolkata. He died last year. I'm so sad. He was charging 1 lakh rupees fees. 1 lakh rupees. And he was giving 1 hour and 1 lakh fees. I know. I should not name him. But I'm not charging that much. My students are charging £150 fee, but I'm charging only £50. For this reason, because they should respect. Homeopathy is not a science of the past, it's a science of the present and future. No matter which disease comes in future, we can treat that illness without going into, confusion. And we can treat any illness in the world. Homeopathy is the only science which can frame and find out the treatment and the remedy or a simillimum without fail, without hesitation, without confusion. I never, since my young homeopathic life, when I was a learner, I was watching others, my seniors, like Dr. Jugal Kishore, Dr. Divan Harishchandji, Dr. Subhash Singh's father, and so many doctors I seen. Dr. Devinder Singh Virk, he was such an ardent fan of homeopathy. We went to one function in Punjab, and he was a chief guest. He cut the ribbon, and when they served the food and everything, he saw in medicine chest there were some combinations, and he was so angry. He said, "What is this? It is homeopathy. It is not homeopathy. You're putting this Nux vomica, Brania, all the mix in one medicine. What is this?" And he left the, scene, and he was rushing, towards the bus stand. I was following him. I said, "Sir, why you are angry?" He said, "No, no, this is not homeopathy. They called me." So this was the feelings. I respect him. He came to England 1979, 89. And we were here for 1 week. I learned a lot of things from him. I don't know where he is now. He was from Patiala. Similarly, I met so many good homeopaths. We have to learn from them. We should not say, "I am the master." Everybody is saying, "I am the master. I am the best." You are not best. You are trying to be best. Dr. Rajan Shankaran's father I met in Mumbai in 1984. Dr. P. Shankaran. Very intelligent. I met some doctors in Mumbai. Doctor, I think he was from South India, very intelligent. I met the most senior doctor in my life, Dr. J.N. Kanjilalji from Kolkata. Patients were queuing 4 a.m. for him. 4 a.m. in the morning, people were queuing outside his house that I want appointment from Dr. J.N. Kanjilalji. I am so lucky that I met him, and he gave me an Ashirwad, blessing, whatever you say. Other thing, we should leave some space in our mind and to learn more from everyone. Just like in England, when there was a king from Scotland, there's a new story. So king was defeated 16 times and he gave up. When he was lying in the cave, he saw some spider going up and down, going up and down. So the spider was trying to reach the ceiling. 16 times the spider failed. 17th time the spider reached the roof or ceiling. And he got up. He said, "This is the God's indication for me to win back my country." And he came back and fought and he won England. Similarly, we failed once, we failed twice, we failed first time. Doesn't matter. You should start with the full confidence, full knowledge, and then treat. Any case coming to me, I am never worried. Why should I be worried? Because I have got a formula of Similia. Similia formula is the best in the world. No matter which illness is there, because all diseases have got signs and symptoms. And based on the signs and symptoms, you can treat any illness. If I'm sleeping and somebody wakes me up, I'll be ready in 30 seconds. I open my eyes, give me the case. I'm not confident. It's the teaching of my teachers. My teachers were so good, special. Remembering my Materia Medica teacher, professor, better say, Dr. Muhammad Ishtaq Hussain Qureshi. Such a wonderful, knowledgeable homeopath from my college. On 15th of August 1967, in the morning around 10 a.m., we were celebrating Independence Day because I just got admission in July and August was the first function. And one young man was rolling on the ground with a pain, colic. And everyone was surprised because we were in the white apron, good shirt and good ties. And then he said, "What's happening?" He said, "Oh, sir, I'm dying of pain." And he was bending. So he asked me, "Hey, yeah, young man, come here." "Yes, sir." He wrote a medicine on the slip. Book, it is just like a book thing. "And go to the pharmacy and bring the medicine." When I approached our OPD, because they were working every day, doesn't matter Independence Day or which day, Sunday, Monday. So the pharmacist was saying, pharmacy officer was saying, "Why you are coming here?" I said, "Sir, I need the medicine." So why? I said some doctor I was just giving him this. I didn't know the name of the doctor. He said, "Oh, he's the head of the department." So he gave me 2 powders. And we went back and he gave 1 powder in the mouth. Within 3 to 4 minutes, he sit up and said, "Oh, sir, what you have given me, sir? This is the magic." Oh my God. That remedy was Colosins 200. Based on the symptom of bending double, the pain, colic, Dr. Muhammad Ishtaq Hussain Qureshi prescribed 2 doses of 200. And 1 dose was given, and they said, "What should I do?" He said, "Don't know, you don't need more." That was the impression we all see how the homeopathy works. And that is a lifetime experience. After 51 years, I am telling you, more than 51 years. 51 years is my practice. You can add 4 years. 55 years, I am telling you this. The first dose of colothin made that person. And he was saying, "Sir, when I was having this problem, I used to go for injection, Baralgan or some injection that time." So after that, I have seen so many miracles in my life, especially with homeopathy. And we had another doctor called J.P. Mukherjee, very, very intelligent. Dr. J.C. Sharma, very intelligent. Dr. K.K. Jaswal, Dr. Chandra. My teachers were so great. I remember them. I thank them every day that they made me from stone to statue. Stone is nothing. You have to shape it to make a statue or portrait of someone or whatever, face of someone. So I was not a very good student as well. This is one thing I'm telling you. I had 2 more better students than me, Dr. Jain, and he was like my brother, and Dr. P.K. Srivastava. I was always second or third. I was never first in my college because you can't say I am the best, you know. Dr. P.K. Srivastava is in Lucknow. He's a practicing homeopath. And Dr. Jain, he died 2 years back. He was a medical officer at Bijnor near Saharanpur. So I remember everything. During our college days, we gave full attention what our teachers are teaching us. And you must follow 3 things in life to get proper homeopath. Follow Mr. Hahnemann, Dr. Hahnemann. Then learn from your seniors. And third, the books available for you, just like Materia Medica's, repertories, organon, philosophy. And you will never fail. And always apply similia. Only similia can help. Otherwise, other conditions will suppress or deviate from the cure. People going to the medicine and coming back, going medicine. Another thing, while I am talking to you, you must remember 2 things. When best selected remedy is not working, at the same time, you retaking the case and the remedy is there. So give sulfur in acute condition. I always give sulfur 1 mg in acute condition and Surinam 1 mg in the chronic conditions. These both remedies are good for acute and chronic conditions. Where acute conditions, the medicine will start working, or it will make you weigh or open the case so that you can find the proper remedy. 99% of the eczema cases, you will find out if you start the case with Surinam, is a chronic, eczema. See the magic. Don't give any medicine. Give Surinam 1 mg dose in the morning. And you should avoid coffee. We should learn and experience from this type of event. Even if you learn 1 point, it will help you whole life. So the most of the conditions where there is eczema of the long standing, especially you see behind the knee and bend of the elbow, redness, itching, sleeplessness. Sleeplessness caused by itching, Surinam is the top remedy. Most of the people are scratching whole night. They can't sleep. It makes them more worse. So Surinam 1 mg, it works after 8 or 9 days. It doesn't work daily. So I have the practice of giving few more powders so that they think they are taking the medicine 1 dose. 1 dose of the Surinam and Seclac 10 doses. Take 1 dose early morning and tell them rinse the mouth. Is the medicine or not doesn't matter. Tell them to practice how to take the medicine. Clean the mouth in the morning, and then take one part of the tongue and don't eat anything 1 hour before or after. And you will see the Suriname will open the case or give you the clear indication for the next remedy. Maybe it is the crotantic, maybe arsenic, meserium, graphitis, any remedy. First you start with the Suriname. Always, always. You will see the magic effects. And if you don't know what to do in a case, what you will do? Take the most important symptom, the most troublesome symptom, and find the remedy based on, because our body is made by God, and it is a procedure of expressing. Signs and symptoms are nothing but the expression of the vital force, what they need. If you are thirsty, you need water. You don't need the music. If you're hungry, you need food. You don't need music. You don't need money. If I give you 20,000 rupees, but you're hungry, you're not going to eat the notes or money. Similarly, find out what is the most troublesome symptom you have to get rid of. Based on that, you will find the treatment. It is called acute treatment. Forget you have the knee pain. Forget you have the diabetes. Forget you have the migraine. Forget you have the hair fall. What is troubling you most at this minute? You find out the remedy, acute condition, cure it, then you can follow the chronic treatment later on. So when you are thirsty and you are very hungry as well, you need water immediately.
Sir, please.
Yes, doctor, sir.
Sir, please.
Yes, sir.
Just I want to submit something to Dr. Pankaj Sharma, sir. So he will be say few words. Dr. Pankaj Sharma sir आएंगे.
आ गए आपके पास?
Yes, sir.
Hello, Dr. Pankaj Sharma. Good morning from United Kingdom. Namaskar, namaskar. Sharma ji, are you coming to London?
Yes, sir.
I can't hear. Please unmute.
Pankaj sir. Unmute कीजिए sir, Pankaj sir. Unmute.
Hello.
Hello, good morning from United Kingdom.
Sir, good afternoon, sir. Good evening. Sir, I will try my best to come to London, and I am very much happy to hear you.
I was telling you, we never said try this. We said I will come.
Yes, sir. I will come, sir. I will come.
This is a lifetime opportunity. I don't know. Honestly speaking, organizing any international event is not a joke. Dr. Sharma ji, the Dean Sam, know what we have done in Lucknow. He was our chief guest, and I respect him. I love him. I thank him for what he did for our conference there. It's not a joke. It's a very tough job. Pleasing everybody is a big problem. Everyone has got, this is called individualization, characterization. So this time, I'm doing this on 28th of October. Most of the people are coming on 26th October and leaving on 31st. Sometimes people are saying, I'm going to Scotland and Norway, Sweden, whatever. So I am not sure what will happen next year. So please come.
I will. Sir, one more thing I want to tell you. One more thing I want to tell you, sir. I am very much impressed from your words, sir. I am always saying to in any conference, homeopathy is never fail. Homeopath can fail.
You're right. We do mistakes and we blame homeopathy. Homeopathy.
Yes, sir. Yes, sir.
We are closing the eye.
We respect always homeopathy.
Yeah. If you are sleeping and closing the eyes in the morning, the sun will rise.
One more. I'm telling to my students and pupils. Take money with dua के साथ. बस दुआ के साथ नहीं. दुखी का पैसा दुआ के साथ, दुखी का पैसा
Sure.
बदुआ के साथ नहीं.
No, we should make
Our
our.
profession is related with the.
We must make our standard. I have seen.
Yeah.
I tell you a very sad story. I tell you a very sad story. You will be shocked. In 2001, there was one conference in Mumbai. I asked Mr. Charles Duncan to come to Mumbai on the request of Dr. Johar Shah, the homeopath gentleman. Yeah. So
Jawar Shah is a very close friend of mine.
Dr. Johar Shah.
Jawar Shah is friend.
Yeah, he's my friend as well. He's everyone's friend. He's a good man. I love him. So from there,
I love you.
the Uttar Pradesh government and our chief Rajnath Singh. So there was one building to be inaugurated, and Mr. Charles Hanneman was invited there for opening. So in the evening, I was going around the town of Lucknow, and I took him around. And there's one place called Kaisar Bagh, and there was a homeopathic shop. I know. I can tell you the name, Dr. Shukla. So we entered his practice, and he was smoking, sitting on the chair. He was smoking. I was shocked. He is sitting in the chamber and smoking. We should not do that. We should be one example for others. Yeah. And Mr. Hanneman was with me. And I was surprised. I said, "Good evening, sir." I was so angry. I said, "You smoking, sitting in the chamber?" He said, "Who are you?" Then I said, "My name is Dr. Shashimon Sharma from England." Then he said, "Sorry, sir, sorry." He put the cigarette on side. Then I said, "You shocked me. You know who is with me?" He said, "I don't know." I said, who was the founder of homeopathy?" He said, "Dr. Christian Samuel Hahnemann." I said, "His great grandson that is standing behind me." He said, "What?" I said, "Yes." So this type of things are very disturbing. We should not do silly things. I don't do anything. I even don't eat anything which is no good for me. Like when I saying don't eat raw onion, garlic, spice, mints, chocolates, coffee, I don't drink myself. We have to be example for our patients and everyone around us. So similarly, we have to do everything what is good for us and for homeopathy. And because we are the example, people follow us. Dr. Sharma is not in the frame anymore.
No, sir, he is again joined. Might be some internet issues.
Please come and see yourself. Please see what we are doing. Homeopathy.
Yes, sir. I'm at your service. I'm at your service, sir.
Welcome. Homeopathy is deeper than Atlantic Ocean. You have to go and dive it, then you find the real jewels. Every day, every minute, every patient is giving us experience. Every patient is testing our ability of treating and the power of homeopathy. So it is in our hand how we live for youngster, next generation.
Yes, sir. We must follow protocol.
Thank you. Dr. Dean, sir, what is the next thing we should
Thank
do?
you, sir. Now I would request our Dean sir to please conclude this conference by vote of thanks.
So now time will come to conclude the session. Really, there was 2 days international virtual conference was very successfully because of all of eminent speakers and dignitaries, high dignitaries. Now, I will vote of thanks. I convey my deep regards and heartily thanks to advisor cum CEO sir, Mr. Vedant Garg sir. I am very much thankful to respected registrar ma'am, Dr. Hema Bafila ma'am. I am thankful to President in charge, Dr. P.K. Raghav sir, and deeply thankful to our chief guest, Dr. Chair Professor Hanuman, Dr. S.P.S. Bakshi sir, and Dr. Shashi Mohan Sharma sir from UK. I am very much thankful to Dr. Sanjay Gupta, Secretary CCH, NCH, and Dr. Subhash Singh, Director NIH Kolkata. The both are guests of honor. I am deeply thankful to Aishali ma'am, Registrar, MP Council, and thankful to our Dr. Pankaj Sharma sir, who is our academic council member as well as Dean DRSSU Homeopathic Jaipur. Special thanks to our faculty members, interns, students, and I also thanks to eminent speakers from
Dr. Kishore Mehta, Dr. Khurana.
Dr. Kishore Mehta, special thanks to special guest Dr. Anil Khurana sir, Dr. Praveen Kumar S sir, Dr. Keynote speaker D.K. Sonkar sir, Lucknow Homeopathic Medical College principal, and Dr. P. Pal Chaudhary, Principal Government Homeopathic Medical College, Bhopal, Dr. Padam Priya Nair ma'am, Professor Heinemann College Homeopathy, Slough, Dr. J.S. Patel from in place of Dr. Nikunj M. Trivedi sir, and so many eminent speakers who are giving their valuable remarks and topics on the topic of our homeopathic faculty of homeopathy science theme. I am also thankful to our technical team, staff members of their cooperation for the event. May success. Once again, and thank you very much to Dr. Shashi Mohan Sharma sir, Pankaj Sharma sir. Yes, sir.
Thank you very much.
Sir, MP Sharma sir, we are very much thankful to you and Ravi Jain. Ravi Jain is a very good, you have done very well, and I am very much thankful to Vedant sir, Hema Wagla ji. We done organize such type of a good conference, and keep it up. My good wishes are with you, and Jyoti Vidyapit will grow definitely in the world of homeopathy.
Thank you, sir.
Thank you so much. I assure you,
from London. Bye bye.
the JVWU, Jyoti Vidyapit Women's University, every year will organize this type of international virtual conference every year.
That's a
And
good news.
all the participants and faculty members who are giving their valuable time for this success of this event. Thank you, Matt. Thank you very much, sir.
Bye bye.
Thank you
From
very
UK.
much.
Bye bye.
Once again, I am
Thank you.
giving the blessing.
Thank you. Thank you. Thanks God, everything went fine.
Thank you. So we officially conclude this 2 days of the session of our international conference. Thank you all for joining. Thank you, sir. Thank you, Pankaj sir. Thank you, Shashi Mohan Sharma sir. Thank you, Dean sir.
Thank you.
Thank you, Padam Priya Nair ma'am, and thank you, our president in charge, sir, who has always been with us during this whole tenure. So I officially conclude this conference, and hopefully we will be meeting next year with this conference with more research paper, more research work, and this process will keep on going. Thank you very much, and thank you all for joining.
Thank you
sir.
very much. Thank you. Bye bye.
So should I leave the studio.